Mr. Speaker, I thought the honourable gentleman was Scottish. It turns out he is a Gaul, or at any rate he has a great deal of Gaul, to say what he has just said when there was 2 hours of debate and the House could have come to a decision, but he, with his friends the Socialists, decided not to allow that vote to happen, and one honourable member managed to talk out his own amendment. This is a most unusual way of carrying on, but the government has done everything it can to facilitate the ability of the House to come to a decision. As I said earlier, if you looked at the schedule of business for Tuesday and the matters that were under discussion, it was extremely likely that the matter would come to a debate. For anybody looking at that order paper, that we did not do so is actually down to the members opposite who decided to talk at length early on. We tried to facilitate the House. That opportunity was not taken advantage of, and I'm deeply sorry about that, because I was hoping that my right honourable friend, the member for Chesham and Amersham, for example, would be able to appear remotely. And the honourable gentleman and the right honourable lady managed to stop that.
For the Parliament.
Speaker, Kettering and Corby Citizens Advice Bureau has just published its latest customer satisfaction survey, which shows that it has helped local people with 25,000 issues to access over £4 million of financial help, and that of its customers, 98% said it was easy to access the service, 99% said they were happy with the advice received, and 100% said they would recommend the CAB to others. Can we have a government statement praising CABs for the wonderful work they do and highlighting the Kettering and Corby CAB, led by Debbie Egan, as a shining example?
Mr. Speaker, I think the only organisation or individual in Kettering that would reach similar levels of satisfaction is my honourable friend, who I think would probably get even higher levels of satisfaction than the 98% achieved by the Citizens Advice Bureau. I would very much like to place on record, on my own behalf and on behalf of Her Majesty's Government, our thanks to the Citizens Advice Bureau, which has offered support and advice to the British people for over 80 years. It does a fantastic job in Bath and North East Somerset, and I'm very glad to hear that it does a fantastic job in Kettering and Corby as well.
West West.
Thank you, Mr. Speaker. As we've heard, today is Carers' Rights Day. Our unpaid carers do an amazing job at any time, but during this COVID-19 pandemic, the pressures on them have been immense. I'd like to thank those unpaid carers in my constituency, and also to thank Gateshead Carers and the Carers Trust Tyne and Wear, who offer them support. But carers' allowance is still only £67.25 a week, which is nothing. So can we have a debate in government time about carers' rights and about the need to increase the benefit allowance?
Mr. Speaker, may I join her in congratulating Gateshead Carers and the other organisations in her constituency that do such fine work to support carers in this difficult period, and reiterate what I said in answer to an earlier question, that it is really important work, a labour of love, literally, and a very lonely labour, probably, in the lockdown circumstance. I cannot promise a debate in government time, but I think to have a debate in backbench business time or in Westminster Hall in celebration of carers is a very worthy thing to do.
Thank
you, Mr. Speaker. I know that my right honourable friend will not want to prejudge the regional tierings, but does my right honourable friend agree with me that it is critically important that we get our great capital city, London, back into the lowest tiering as quickly as possible? And will he countenance a debate on how we do restore our great capital city to its former glory?
Mr. Speaker, I'm not sure it's in order for me to cede the dispatch box to my right honourable friend who is standing by your side, but my honourable friend has timed her question to perfection because she has called for our great bustling metropolis to be able to bustle just before my right honourable friend comes in to make his statement. And while London does have lower rates than some of the other regions in England, it is still at a higher level than before, and the government will monitor the information from a variety of sources so that the decisions made are on an evidence basis. I, like my right honourable friend, the Prime Minister, and one of the House's many optimists. And as we make progress with considerable speed to mass testing and get closer and closer to a rollout of mass vaccinations, I believe that London's economy will soon be fighting fit again, and I hope to see our black taxis as full and as busy and as bustling as they were before the contagion hit.
Let's head up to North Tyneside with Mary Glindon. Mary Glindon.
Thank you, Mr. Speaker. Can we have a debate in government time on the morale of workers across government departments in wake of their real terms pay cut announced yesterday, and with civil servants living in fear thanks to the Prime Minister that they now have no redress against bullying and harassment?
Mr. Speaker, I completely reject the premise of the last part of the Honourable Lady's question. It is a misrepresentation, an inaccurate representation of what was found by the Prime Minister earlier in the week. As regards what the Chancellor announced yesterday, it is worth pointing out that private sector wages have fallen by 1%, whilst the public sector has risen by 4% over the last year, and that ultimately, without the private sector, we have no money to afford the public sector. And therefore there needs to be some degree of parity between the two. And most importantly, the least well-off, those below median wages, so those below £24,000 a year of earnings, will receive an increase of at least £250 a year, which with inflation running at 0.5% is above inflation increase.
34 withdrawn, so to Munira Wilson.
Thank you, Mr. Speaker. Yet again, yesterday, the Chancellor completely overlooked the 3 million people who have been left out of any financial support during this pandemic. The Leader of the House will be aware that the APPG in gaps in support with 262 MPs is one of the largest APPGs in Parliament, yet the Chancellor has refused to answer many of our letters or refused to meet with us or engage with representatives of the groups he's forgotten about. So my request is very simple to the Leader of the House. Will he ask his right honourable friend, the Chancellor of the Exchequer, to meet with representatives of the APPG and the groups that he has neglected?
Mr. Speaker, I don't again accept the representation of what the Chancellor has done, that the government has provided £280 billion worth of support. There is support available in different forms for many, many people across this country, and every effort has been made to support the economy as widely as possible. However, I have always viewed it as my role as Leader of the House to try and facilitate meetings between members and ministers. I cannot promise a meeting with the Chancellor of the Exchequer, but I will do my best to try and facilitate a meeting with ministers in due course for the Honourable Lady.
Is it relevant to these questions?
It is very
Okay.
Thank you, Mr. Speaker. I know it's unusual to take points of order before statements, but this is a matter of extreme importance. At 11:14, it was announced that you could find out which tier you were in via a journalist rather than the statement to the House. Now, I know the Secretary of State is standing outside. I think this is an absolutely appalling way to treat Parliament. Could I have your advice on whether this was an appropriate thing to do? In fact, the website has crashed because everybody is on it. There's no point in being in this chamber, Mr. Speaker, where we should hear the announcement first. We might as well be sitting remotely, which the Leader of the House isn't allowing. Could I have your advice on whether this was an appropriate way to deal with the tiers? Important information.
What I would say is it's not a point of order to the Chair, but I do have an opinion. This House, and I'm sure the Leader of the House totally agrees with me, this House should be informed first. We keep telling the government that is the way that good government should treat and respect this chamber. It is not acceptable to put it online. The only good thing is about the government, it's crashed, so it's not helpful. So it might be that we do get the statement first, but it is not acceptable. I do say, once again, I know the Leader will pass on, in the strongest terms, this House should hear it first. We are elected to hear it first, and they should give the respect that this House deserves. I don't know if the Leader wants to comment. Should we leave it at that? OK. Right, let's move on to say that in order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I'm suspending the House for 3 minutes. Order. Okay. We now come to the statement. I call the Secretary of State, Matt Hancock. Secretary.
Mr. Speaker, with permission, I'd like to make a statement on coronavirus. We're approaching the end of a year where we've asked so much of the British people. And in response to this unprecedented threat to lives and to livelihoods, the British people have well and truly risen to the challenge by coming together to slow the spread and support each other. I know how difficult this has been, especially for those areas that have been in restrictions for so long. The national measures have successfully turned the curve and begun to ease pressure on the NHS. Cases are down by 19% from a week ago, and daily hospital admissions have fallen 7% in the last week. January and February are always difficult months for the NHS, so it is vital we safeguard the gains we've made. We must protect our NHS this winter. We've invested in expanded capacity, not just in the Nightingales, but in hospitals across the land, and we've welcomed thousands of new staff. Mr. Speaker, this morning's figures show the number of nurses in the NHS is up 14,800 compared to just a year ago. Well on our way to delivering on our manifesto commitment of 50,000 more nurses. Together, while we invest in our NHS, we must also protect our NHS. So it'll always be there for all of us during this pandemic and beyond. Mr. Speaker, I'm so grateful for the resolve that people have shown throughout the crisis. Thanks to this shared sacrifice, we've been able to announce that we will not be renewing our national restrictions in England. And we've been able to announce UK-wide arrangements for Christmas, allowing friends and loved ones to reunite and form a 5-day Christmas bubble. And I know that this news provides hope for so many. But we must remain vigilant. There are still today 16,570 people in hospital with coronavirus across the UK, and 696 deaths were reported yesterday. That means 696 more families mourning the loss of a loved one, and the House mourns with them. So as tempting as it may be, we cannot simply flick a switch and try to return life straight back to normal. Because if we did this, we would undo the hard work of so many and see the NHS overwhelmed with all that that would entail. We must keep suppressing the virus while supporting education, the economy, and of course the NHS until a vaccine can make us safe. That is our plan. We will do this by returning to a tiered approach, applying the toughest measures to the parts of the country where cases and pressure on the NHS are highest, and allowing greater freedom in areas where prevalence is lower. While the strategy remains the same, the current epidemiological evidence and clinical advice shows that we must make the tiers tougher than they were before to protect the NHS through the winter and avert another national lockdown. So we've looked at each of the tiers afresh and strengthened them, as the Prime Minister set out on Monday. In Tier 1, if you can work from home, you should do so. In Tier 2, alcohol may only be served in hospitality settings as part of a substantial meal. And in Tier 3, indoor entertainment, hotels and other accommodation will have to close, along with all forms of hospitality except for delivery and takeaway. Mr. Speaker, I know that people want certainty about the rules they need to follow in their area. These decisions are not easy, but they are necessary. We've listened to local experts and been guided by the best public health advice, including from the Joint Biosecurity Centre. We set out the criteria in the COVID-19 winter plan, and we published the data on which the decisions are made. As the winter plan sets out, the 5 indicators are the case rate in all age groups, in particular cases amongst the over 60s, the rate at which cases are rising or falling, the positivity rate, and the pressures on the local NHS. When setting the boundaries for these tiers, we've looked not just at geographical areas, but the human geographies which influence how the virus spreads, like travel patterns and the epidemiological situation in neighbouring areas. While all three tiers are less stringent than the national lockdown that we're all living in now, to keep people safe and to keep the gains that are being made, more areas than before will be in the top two tiers. This is necessary to protect our NHS and keep the virus under control. Turning to the tiers specifically, the lowest case rates are in Cornwall, the Isle of Wight and the Isles of Scilly, which will go into Tier 1. In all three areas, they've had very low case rates throughout, and I want to thank residents for being so vigilant during the whole pandemic. I know that many other areas would want to be in Tier 1. I understand that. My own constituency of West Suffolk has the lowest case rate for over 60s in the whole country, and I want to thank Matthew Hicks and John Griffiths, the leaders of Suffolk and West Suffolk councils, and their teams for this achievement. But despite this, and despite the fact Suffolk overall has the lowest case rate outside of Cornwall and the Isle of Wight, our judgment, looking at all of the indicators and based on the public health advice, is that Suffolk needs to be in Tier 2 to get the virus further under control. Now, I hope that Suffolk and so many other parts of the country can get to Tier 1 soon, and the more people stick to the rules, the quicker that will happen. We must make the right judgments guided by the science. The majority of England will be in Tier 2, but in a significant number of areas, I'm afraid, they need to be in Tier 3 to bring case rates down. Now, I know how tough this is, both for areas that have been in restrictions for a long time, like Leicester and Greater Manchester, and also for areas where cases have risen sharply recently, like Bristol, the West Midlands, and Kent. The full allocations have been published this morning and laid as a written ministerial statement just before this statement began. I understand the impact that these measures will have, but they are necessary given the scale of the threat that we face. We'll review the measures in a fortnight and keep them regularly under review after that. I want to thank everybody who's in the Tier 3 areas for the sacrifices that they're making, not just to protect themselves and their families, but their whole community. And regardless of your tier, I ask everyone, we must all think of our own responsibilities to keep the virus under control. We should see these restrictions not as a boundary to push, but as a limit on what the public health advice says we can safely do in any area. But frankly, the less any one person passes on the disease, the faster we can get this disease under control together, and that is on all of us. Mr. Speaker, we must all play our part while we work so hard to deliver the new technologies that will help us get out of this, in particular vaccines and testing. The past fortnight has been illuminated by news of encouraging clinical trials for vaccines, first from Pfizer-BioNTech and then Moderna, and then, of course, earlier this week from the Oxford-AstraZeneca team. If these vaccines are approved, the NHS stands ready to roll them out as soon as safely possible. Alongside vaccines, we've made huge strides in the deployment of testing. Our rollout of community testing has been successful because it means we can identify more people who have the virus but don't have symptoms and help them isolate, breaking the connections that the virus needs to spread. As part of our COVID-19 winter plan, we'll use these tests on a regular basis. For instance, to allow visitors safely to see loved ones in care homes, to protect our frontline NHS and social care colleagues, and to allow vital industries and public services to keep running safely. Mr. Speaker, we've seen in Liverpool, where now over 300,000 people have been tested, how successful this community testing can be. And I want to pay tribute to the people of Liverpool, both for following the restrictions and for embracing community testing. It's been a big team effort across the whole city, and the result is that in the Liverpool city region, the number of cases has fallen by more than 2/3. In the borough of Liverpool itself, where the mass testing took place, cases have fallen by 3/4. It hasn't been easy, and sadly, many people in Liverpool have lost their lives to COVID. But thanks to people sticking to the rules and to the huge effort of community testing, Liverpool's cases are now low enough for the whole city region to go into Tier 2. This shows what we can do when we work together. We can beat the virus. And I want to pay tribute to the people of Liverpool, to NHS Test and Trace, the university, the Hospital Trust, and Mayor Joe Anderson, and so many others who've demonstrated such impressive leadership, responsibility, and a true sense of public service. We're now expanding this community testing programme even further to launch a major community testing programme honing in on the areas with the greatest rate of infection. This programme is open to all local authorities in Tier 3 areas in the first instance and offers help to get out of the toughest restrictions as fast as possible. We'll work with local authorities on a plan to get tests where they're needed most and how we can get as many people as possible to come forward and get certainty about their condition. The more people who get tested, the quicker a local area can move down through the tiers and get life closer to normal. Mr. Speaker, viruses can take a short time to spread, but a long time to vanquish, and sadly there is no quick fix. They call upon our determination to make sacrifices that will bring it to heel, and our ingenuity to make scientific advances that will get us through. Hope is on the horizon, but we still have further to go. So we must all dig deep. The end is in sight. We mustn't give up now. We must follow these new rules and make sure that our actions today will save lives in future and help get our country through this. And I commend this statement to the House.
The Secretary of State, Jonathan Ashworth.
Mr. Speaker, and can I thank the Secretary of State for advance sight of his statement? And I suppose we should all thank him for advance sight of the website, but sadly it crashed before we could check what tiers we were in. Now, the news of a vaccine is indeed light at the end of the tunnel, but we are still in the tunnel, and we have a significant way to go to drive infection rates down and keep our constituents safe. Now, we understand why tough restrictions are still needed. But let's be clear, today millions of people trying to survive in the second lockdown will soon be forced to endure further local lockdown restrictions. So does he accept that these interventions succeed when made in tandem with local communities? Because I remember when areas like Bury and Trafford went into lockdowns in the summer, the Secretary of State promised that MPs would be involved in the decision. Has that commitment now been abandoned? Then ministers agreed to involve regional leaders, but took exception to being challenged by Andy Burnham. So what role do regional leaders now have in these decisions? Or is it really the position that the Prime Minister imposes from Downing Street restrictions on communities across the Midlands and the North, restrictions that will have a huge impact on the livelihoods of families and small businesses? Christmas, he will know, is vital for pubs, for restaurants, for entertainment venues across these areas. They will need substantial financial support to get through this period. And will those areas that went into Tier 3 lockdowns before the national lockdown, like Greater Manchester, South Yorkshire, now get backdated economic support for their local small businesses? There are now parts of the country, like my own city Leicester, like Bury, like Lee, like Haywood, that have been under a form of lockdown for months and months and months, where families have been forced apart, where grandparents haven't seen their grandchildren. Those families tonight will want to know what the exit strategy is and what voice they will have in that strategy. Now, he has outlined 5 criteria by which local lockdowns will be judged. Will he publish clear, transparent rules for areas entering and leaving tiers? A scorecard, if you like, for every area, assessing their COVID progress against their criteria so everyone can judge it publicly. Now, he talks of mass lateral flow testing, which we welcome the advances. But over 2 weeks ago, he announced he was sending, I think, 930,000 of these tests to local authorities, yet only around 8,500 are currently being used a day. Could he explain why that is? He will also be aware, I'm sure he studied it, that Slovakia recently tested over 3 million people over a weekend using these tests. They incentivised people to get tested by offering greater freedoms. Is that part of the government's thinking for how these tests could be used? Now, evidence from Liverpool suggests that there is a lower penetration of take-up of these tests in poorer, harder to reach communities. See, isn't the problem, Mr. Speaker, that if people and their contacts feel they will be financially penalised for a positive test, that they will avoid a test, they'll switch off the app, they won't answer their phone to unrecognised call centre numbers. And the reason people just soldier on when ill isn't because of stiff upper lip, it's because they can't afford to feed their families otherwise. So surely, after months and months, it is now obvious that people, low-paid people, like care workers on 0 hours contracts, need better support to isolate. So why didn't the Chancellor increase statutory sick pay in the spending review yesterday? The test and trace budget has now increased to £22 billion. That's more than the annual budget for the police and the fire service combined. Yet the OBR yesterday confirmed that their forecasts are based on the fact that, quote, a less effective test, trace and isolate system necessitates keeping a more stringent set of public health restrictions in place over the winter. So at what point will he accept that the current model, that the Serco model, has failed? I'm not against using the private sector, but I am against throwing shed loads of taxpayers' money at failing private sector contracts, Mr. Speaker. Local authorities, especially those now in Tier 3, should be leading this retrospective contact tracing work, and they should be given the data from day one so they can get on with it. And by the way, Mr. Speaker, why was there no uplift yesterday in the public health grant? Surely this is a time when we should be investing in public health, not freezing the grant. Now, on the easements for Christmas, there will indeed be relief from families across the country, but he will understand that there will also be nervousness across the NHS. We need a clear public health message. Asking people to be jolly careful is not good enough. He will know that January is an immensely busy and pressured time for our NHS. It's not just the patients filling up COVID beds, it's the emergency pathways which are already running at hot. It's the immense elective backlog. We know there are less beds because of social distancing. We know staff are exhausted. 1 in 7 hospitals have restricted electives or planned operations so far this winter. So what plans are in place to protect the NHS through January, especially if there is a long, cold winter snap? How many elective operations does he anticipate will be cancelled in January? Now, nobody in this House wants to see a third lockdown. So can he guarantee that the measures he has announced today will be enough to bring the R down and sustain it below 1 for the coming months until a vaccine allows life to return to normal?
Thank you very much, Mr. Speaker. The goal of the government is to bring R to below 1 to suppress the virus until a vaccine can keep us safe. That is the strategy, taking the precise points that the honourable gentleman raised. He asked for an exit strategy. The statement I outlined is the exit strategy. It is to keep this virus suppressed with the minimum damage possible to the economy and indeed to education, whilst we work as fast and as hard as we can towards a vaccine and the use of community testing widespread across the piece to help to keep the virus under control. I would have expected him, Mr. Speaker, to have welcomed the massive progress in Liverpool that has shown that a combination of sticking by the rules and community testing at very large scale can help to bring this virus right under control. Instead, he criticised that it doesn't get into harder to reach communities. That is exactly where we need to get into, and that's why we do it in combination and hand in hand with the local authority. And I praised Joe Anderson. I'd also praise other local leaders, Ben Houchin in the Tees Valley, who's working with us on this, Andy Street and leaders across the West Midlands, Dan Jarvis in South Yorkshire, who we're working with to get a community testing system up and running in places like Doncaster. I want to see this community testing, which has been successful in Liverpool, rolled out right across the Tier 3 areas as much as is possible. And I invite all councils to engage. We engaged with councils and invited them to engage ahead of the decisions today. And we also invited all colleagues from around the House to put their input in. But it is important that we have clear public health messaging, because unfortunately we did see the impact on the number of cases going up and continuing to go up in those areas where local leaders were not working alongside us. And it was a sharp contrast to what happened, for instance, in Liverpool, but also in other areas where the local leadership were so constructive and positive. He asked for a scorecard in terms of the exit strategy. I think that's a good idea. We published this data. If we can make it into an even more accessible format, I think that is a good idea. He asked about supporting the NHS. Absolutely, and I'm delighted that yesterday my right honourable friend, the Chancellor of the Exchequer, with the support of the Prime Minister, put another £3 billion into the NHS on top of the £6.6 billion that's already being invested, and that money starts flowing this financial year for this winter and then runs into next year. He also mentioned the need to support people who've tested positive. We've put in place a £500 support payment. And on test and trace, NHS test and trace, Mr. Speaker, I thought from the figures this morning he would have welcomed the fact that the majority of in-person tests are now turned around within 24 hours. Really significant progress on the speed of turnaround in testing, for which I am very grateful to my team. There will be further support for local councils that find themselves in tiers 3 and 2 to support the action that is needed. But all in all, Mr. Speaker, let us come together and work together to get this virus under control, keep it under control, so that we can get life back to normal as soon as possible.
Thank you, Mr. Speaker. Can I welcome the Prime Minister back from his splendid isolation to the place he has no doubt been itching to get back to more than any other, this House of Commons, and say how wonderful it is to see him here. And great to see you. Thank you, Madam Deputy Speaker. I think from a sedentary position, the Prime Minister said he was delighted to see me here. These are very difficult decisions, and indeed delighted to see me here on the back benches. These turning to more serious matters, Madam Deputy Speaker, these are very difficult decisions, and part of the leadership you have to show in a pandemic is telling people unwelcome news, and I want to salute the Health Secretary's cautious approach to Christmas, because much as we all want Christmas to be as normal as possible, nothing would be more crazy than to take our feet off the accelerator at this moment and then see a spike in deaths in February. And so I think this is the right approach. There is one bit of further good news on top of the news about vaccines, on top of the news about mass testing, which I know he would like to be able to give and would be enormously welcome, and that is if every single person living in a care home could be sure that they could be visited by a close relative before Christmas. Now, I know he wants to do that, but there are huge logistical challenges in getting that mass testing technology to work in time. Could I just urge him to do everything he can, because that would make such a big difference to the nearly 400,000 people in care homes.
Madam Deputy Speaker, I hesitate to interrupt the love-in between the Prime Minister and my predecessor. But I'm grateful to his support. I'm grateful to their support. And this is a set of difficult measures, but I think the public understands why we have to take them and why they are necessary. On the point about getting visiting going in care homes, he's absolutely right. You know, sometimes we talk about these tests and this new technology in an abstract way or from a scientific point of view, but it really matters, and it really improves people's lives. And where we can use testing to make visiting safe in care homes, that is an example of the sort of thing that these new technologies can help to get life a little bit back towards normal. Of course it's got to be done in a safe way, and of course it's got to be done carefully, but we are now developing the protocols for exactly how that can happen, and working hard with the goal that everyone should have the opportunity to visit a loved one in a care home before Christmas.
And now we go to Dr. Philippa Whitford.
Thank you, Madam Deputy Speaker. Many scientists have expressed concern that the easing of restrictions at Christmas could lead to another surge of COVID cases in January. With cases still over 80% of the level at the start of lockdown, is the Secretary of State not worried that allowing outdoor events of 2,000 participants and indoor events of 1,000 in level 2 high-risk areas could actually drive up infection rates ahead of Christmas? While the lateral flow testing is very welcome in how it increases capacity, the Secretary of State previously stated the mass testing in Liverpool was a pilot and would be evaluated before being rolled out elsewhere. As the city has also been under tight restrictions and then lockdown, how will the impact of mass testing alone be evaluated? How does he plan to counter the lower uptake among deprived communities, the very ones at highest risk seen in Liverpool? And with no clinical evaluation yet published, how can he justify putting out contract tenders for an eye-watering £43 billion and rolling out this approach to 67 other areas? Should this strategy not be compared with investing money and energy in getting the traditional test, trace and isolate system working properly? Currently, over 40% of contacts in England are still not even informed they should be isolating. Finally, he knows it's not testing, but isolation which stops the spread of the virus. And if people who are infected or could be carriers are not isolating, no amount of testing will stop viral spread. The study by King's College, which suggested less than a quarter of people were isolating when advised, was incredibly worrying. So what assessment is the government doing to clarify current isolation rates and understand the reasons why people may not follow the advice they are given?
Thank you very much, Madam Deputy Speaker. Well, of course, we're constantly evaluating the impact of people isolating and how many people isolate when asked to. I would just encourage the Honourable Lady to look at a broader range of studies than just that one from King's College, and especially when you look at the self-isolation of those who test positive, which does tend to be higher. She asked about the use of these lateral flow tests to have a negative impact on the number of cases in an area. Of course, we've been evaluating this all the way through the study in Liverpool, and that's why we can have confidence in rolling it out more broadly across Tier 3 areas. I included in my statement a high-level assessment of this, which is that if you look at Liverpool City region, the number of cases is down by 2/3, but in the city itself, where the testing took place, it took place of people who live in the city and of people who work in the city and live largely in the wider city region. The number of cases is down by over 3/4. Now, that's one piece of evidence. It is clear that it's the combination of people following the rules and the community testing put together with the appropriate incentives to get people to take up the mass community testing. That is what can help to make this work, and we want to work with local directors of public health to understand and to know how this can work effectively in their areas, precisely to reach the hard to reach that she mentioned. Finally, I would echo, Madam Deputy Speaker, the request from the Honourable Lady that we be cautious this Christmas. But I would say to her that having agreed an approach across the whole UK, including with the SNP government in administration in Edinburgh and with the Welsh Labour administration and the cross-party administration in Northern Ireland, I'm delighted that there is an approach all the way across the UK, because there are so many ties that bind us together, which mean that we are stronger as one united kingdom working together to tackle this virus.
Greg Smith.
Thank you, Madam Deputy Speaker. It's incredibly disappointing news that Buckinghamshire, having entered the national lockdown in Tier 1, will emerge from the national lockdown into the more punitive restrictions of Tier 2. A decision that will be hard to understand in the rural communities of North Buckinghamshire that have relatively low infection rates, and a decision hard to understand given that there has been zero consultation between central government and Buckinghamshire Council and our local NHS. Appreciating that my right honourable friend has impossible choices to make to control this virus, will he commit to ensuring that Buckinghamshire Council and our local NHS is fully consulted as these tiers are reviewed going forward?
Well, yes, of course. Along with my honourable friend, the Director of Public Health in Buckinghamshire was invited to engage with the team as we were looking at the indicators and making this decision. These are difficult decisions. He's absolutely right about that. The case rate in Buckinghamshire is 138 per 100,000, and positivity is above 5%. We'll be reviewing these allocations in a fortnight and then regularly thereafter. And I look forward to working with my honourable friend and supporting the people of Buckinghamshire to do what is right and to get these case rates down and to get Buckinghamshire, if at all possible, if it is safe, into Tier 1 with the lighter restrictions. But it is critical to keep people safe that we take the action that we need to today.
Monira Wilson.
Thank you, Madam Deputy Speaker. A recent UCL study found that with the previous tier system, less than half the public understood what the rules were for the tiers. So today we have a new tier system. We have a 5-day relaxation at Christmas. We have a government website that's just crashed this morning. The written ministerial statement that's been published this morning has got a number of question marks against different areas. There have been inconsistencies regarding timing between what the Prime Minister has said, what the OBR has said, and what the Secretary of State has told MPs in terms of length of restrictions. So I have a very simple request. Will the Secretary of State please ensure there is a very clear, consistent and honest communications campaign to ensure public trust, compliance, and so that we don't overly raise expectations?
Yes, there'll be a very widespread public information campaign about these new tiers because it's on all of us to follow the rules in our local area and out with the rules. You know, notwithstanding the rules, make sure that all of us, we all need to behave in a responsible way because we all have a role in controlling the spread of the virus.
Now we go to York, to Julian Sturdy.
Thank you, Madam Deputy Speaker. As the government continues to impose further unprecedented restrictions on people's freedoms, it's important to give people hope and justification. So as York's COVID rate continues to fall and is the lowest in Yorkshire, can the Secretary of State outline how we can get to Tier 1 baseline as fast as possible? And will he publish the assessment and the data under which York was placed into Tier 2 so we can best judge how to get to Tier 1? And when he talks about regular reviews, can I say a weekly review, Secretary of State, would be much more desirable?
Yes, I can answer positively on all counts. We have a regular weekly session to go through all of these. I say regular rather than... I'm committing to regular reviews rather than weekly, simply because sometimes we have to do it more than weekly, especially if you see the cases shooting up in an area. On the point about publication, absolutely. We've published today not just the data, and we'll publish more data on each area, but also an explanation in each area for the reason for the decision that was taken. I know that he and colleagues across York have worked hard because there was quite a serious spike in York that is coming down at the moment, but overall we still require the whole of North Yorkshire to go into Tier 2 because the case rates are still elevated right across North Yorkshire, and we all need to work together to get them down.
Ruth Cadbury.
Thank you, Madam Deputy Speaker. And I share my neighbouring colleague, the Honourable Member for Twickenham's concern about clarity over tiers and messages. But one message and one rule that is clear but is unwelcome is the 11 p.m. curfew for pubs and restaurants. Curfews fail to address the issue of crowds in the streets and on public transport, which have a risk of spreading infection. So will he commit to meeting with London Government, including the Mayor of London, as soon as possible to discuss this and agree the criteria London needs to meet to de-escalate as soon as possible?
Well, of course we've been engaging with the team who've worked across London. There is a lot of work to do in London. There are parts of London where the cases continue to rise and we need to get that under control. But there are also parts where they are falling and things are very much going in the right direction. Likewise, there's pressure in some parts of the NHS, but there's a lot of mutual aid within the NHS right across London. So there's a lot of work to do in London to keep it in Tier 2, and I look forward to working with her and other London colleagues on that.
Dr. Ben Spencer.
Thank you, Madam Deputy Speaker. People living in Runnymede and Weybridge often ask me what basis we are subject to the local tiers and restrictions, and it's clear that alongside the data, there's other factors taken into account around these tier decisions, and I thank my right honourable friend for his response to the question for the honourable member for York Outer, that both the reasons and the data we published. Will local hospital bed utilisation be part of those reasons published?
Yes, there are 5 indicators that we take into account on deciding on which tier. One of them is pressure and anticipated pressure on the local NHS, where of course bed occupancy rates is a critical part of that assessment. I know that I know that people are looking for a clear numerical boundary between the different tiers, but because we're looking at 5 different indicators rather than a single one, there is no automatic figure at which a different tier is triggered. We've got to look at all circumstances, including, for instance, in terms of outbreaks. Because there are some cities that on their pure numbers would be in Tier 3, but because the outbreak is specific, for instance in a school or care home, then it's appropriate that they're in Tier 2. So you have to look at these very localised issues as well. That's why the engagement with local directors of public health is so important.
Sir Robert Sims.
There will be bitter disappointment in Dorset, both in the urban and rural area, that we're in Tier 2, although our infection rates actually are now falling quite rapidly. So my main interest today is finding out how we get out of Tier 2 into Tier 1. If we're going to have regular reviews, i.e. weekly, that's great and that's fine. But if we're not, if we're stuck in that tier for 2 or 3 weeks, I wonder whether the Secretary of State would consider some kind of appeals process. And I wonder whether his Minister of State, the admirable member for Charnwood, might be the appeals process.
We work as a very cohesive team of ministers in the department, and we all work on COVID-related issues. I take the gentle chiding from my right honourable friend that he would rather my number 2 take these decisions, but I'm afraid he's stuck with me for the time being. Of course, on the serious point that he raises, we will review these in a fortnight and then regularly, by which he can reasonably take weekly. We have a weekly cycle of meetings with the Chief Medical Officer chairing a meeting on typically on a Tuesday. I then chair the meeting on a Wednesday for an announcement on Thursday for any change to the tiers.
Now we go to Swansea, to Geraint Davis.
Madam Deputy Speaker, the Secretary of State knows I chair the all-party group on air pollution, so I won't be surprised that I point out that the Tier 3 areas tend to be the areas of highest pollution, because for every microgram of PM2.5 per cubic metre, that increases the COVID deaths by between 18 and 14%, and that's on top of the 40,000 deaths annually from air pollution. So would he agree with me that we need cross-government activity and an all-government report annually from DEFRA, from housing, from transport, on what they're doing individually and collectively to combat air pollution, and in so doing to reduce the COVID death rate and the overall death rate? I can see that the Prime Minister is nodding sagely. Would he agree with an annual report?
Well, it's very impressive that he can see the Prime Minister since he's just left the chamber. But I'm sure the Prime Minister is nodding sagely wherever he is. But the honourable gentleman makes a very serious point, and it's a very important point on which we agree, which is that air pollution is a serious health issue, and in lockdowns, air pollution has reduced. Now, that is one upside to what are otherwise very damaging things to have to do, but they are necessary to keep the virus under control, and I hope that we can continue to work together on tackling air pollution long after this pandemic's over.
Richard Graham.
Madam Deputy Speaker, for Gloucestershire in Tier 2, next to South Gloucestershire in Tier 3 and the Welsh border, can the Secretary of State confirm that there will be no travel restrictions between different tiers, or across the Welsh border? And could he also, since the government can change tiers without debate, which has a huge impact, especially on the hospitality sector from Tier 2 to 3, would he also confirm when the date for the tier decisions will be published?
I'm afraid I can't confirm with respect to the Welsh border, because the restrictions on travel, the legal restrictions on travel, were a decision by the Welsh administration rather than by the UK government for England. We've taken the view that travel restrictions should be in guidance, because there's all sorts of complicated circumstances under which people might need to be might need to travel, and we've done that when we've been in national lockdown across England as well as locally. So I'm afraid I'm sorry that I can't be clearer than that. On the point about renewal and when we review these matters, we are proposing to review firstly on the 16th of December and then regularly thereafter to make sure that we keep the tiered restrictions as up to date as possible.
Now we go to Yvette Cooper.
Thank you, Madam Deputy Speaker. The Health Secretary will know the pressure that Pinderfields especially has been under. Staff have been doing an incredible job, and it is welcome that the number of COVID patients in hospital is starting to fall, and the number of infections locally has fallen by around 30% in the last week. But he will also know that our NHS, social care and public health staff have had a really difficult year, and the winter is going to carry on being tough with many operations to catch up on. So will he now look swiftly at the case for added support and pay for NHS, public health and social care staff this winter in recognition of the incredible job they have been doing to care for all of us?
Thank you very much, Madam Deputy Speaker. Well, I'm delighted that there's a significant increase in the number of NHS staff, and the figures published this morning show there's 14,800 more nurses than there was this time last year in the NHS. I'm really pleased about that. When she, and of course yesterday, she will have no doubt seen that the pause on pay increases across the public sector announced by my right honourable friend the Chancellor doesn't apply to nurses and doctors, and that is in part in recognition for the incredible work that they've done during this pandemic.
Jeremy Wright.
Thank you very much, Madam Deputy Speaker. As the economic damage the pandemic is doing becomes increasingly apparent, it's clearly right that businesses of all types are reopened as soon as it's safe to do so. Now, that's going to take longer than it needs to if the restrictions on those businesses are calculated on the basis of virus information for places a long way away, or as a geographical average for a wide area encompassing urban and rural parts. That's exactly what's going to happen to the businesses in my constituency, which will not be able to open if they are hospitality businesses next week, not because of the rates where they are, but the rates somewhere else. Surely it's more sensible to calculate restrictions on the smallest geographical area where data is reliable, that largely being boroughs and districts. Will my right honourable friend commit in his review in 2 weeks' time to look not just at whether individual areas are in the right tier, but whether the areas are properly constructed?
Yes, absolutely. My right honourable friend is absolutely right about the importance of this. We have to balance the need for an area to be the human geography in which people live, and be able to effectively communicate the tiering decisions across a geography with precisely the concern that he mentions. For instance, Slough is in Tier 3, despite the fact that Berkshire, of which it is a part, is in Tier 2. So we are prepared to take those decisions at a lower tier local authority area level. That is the exception rather than the norm, but we look at it every single week.
Now we go to Ayrshire, to Patricia Gibson.
Thank you, Madam Deputy Speaker. COVID-19 is a world pandemic, and so it needs to be tackled on a global basis. International travel will expose the UK to future outbreaks, particularly if the virus mutates. So on both humanitarian and public health grounds, does the Secretary of State not agree that it is indefensible to cut the international aid budget just as a global vaccine rollout begins?
Well, of course, we have been hugely supportive, and in fact, the UK is the biggest supporter internationally of providing vaccines in countries that wouldn't be able to afford them themselves. And I'm sure that that will continue because we will continue to have one of the largest international aid budgets in the world.
Peter Aldous.
Thank you very much, Madam Deputy Speaker. I know that my right honourable friend will thank everyone in both East and West Suffolk for getting down the level of infections, and that it is with a heavy heart that he has concluded that the county cannot exit Tier 1. Will he ensure that there are very clear indicators as to what else needs to be done so that Suffolk can move to Tier 1 as quickly as possible? And will he liaise with his right honourable friend, the Chancellor of the Exchequer, to put in place additional support for the very hard-hit hospitality sector?
Of course, I have constant discussions with the Chancellor of the Exchequer about the support that's needed, and my honourable friend is right to raise it, especially in Suffolk. And what I would say is that it is with a heavy heart that we took the decision on Suffolk. Its case rate is higher than the Isle of Wight and Cornwall, which are the two areas currently in Tier 1, but that does give an indication of where we need to get to, and I'm sure that if we all work together, then we'll be able to get there.
Emma Lewell-Buck.
Thank you very much, Madam Deputy Speaker. We are stuck in an endless cycle of lockdowns that simply are not working. The government have again wasted the opportunity over the last few weeks to get a handle on testing, tracing and isolating. So once again, hospitality in South Shields is going to be absolutely battered and my constituents' liberty impacted on. Can the Secretary of State tell us exactly what is going to be different this time that will make our sacrifices yield a reduction in the infection rates?
Firstly, I would urge the Honourable Lady to look at the figures published this morning showing that the majority of tests are now, when done in person, are now turned around within 24 hours. Across the country, and capacity is radically increased. And what I'd ask of her for the future, and to help the North East get out of Tier 3, is to work with her local councils, with the Directors of Public Health, to embrace the community testing that's been effective in Liverpool. And if they're up for doing that, and it has to be in consultation and in conjunction with the local council because they know the area, I very much hope that they'll come forward and pick up the baton and make that happen.
Now we go to Tewkesbury to Lawrence Robertson.
Thank you, Madam Deputy Speaker. This is not an easy question, but how can the Health Secretary take into account the wider mental and physical health implications for people who are prevented from living their lives as they would wish to live them?
Of course, we look as much as we can to take these impacts into account. For instance, the mental health of people under lockdown is, of course, more challenged than in normal circumstances. And we balance that both against the impact of COVID directly and also the impact of COVID filling up hospitals on the healthcare that we can all get for all the other conditions that exist. It is a difficult balance to strike. On the particular impact of mental health that he raised, the Royal College of Psychiatrists has been very interesting in terms of the work that they've done to understand the nuanced balance between the impact of COVID on people's mental health and the impact of lockdown on people's mental health. Both are significant, and I commend their work to him.
Now we go to Mary Glindon.
Thank you, Madam Deputy Speaker. And it's devastating that after all its efforts, the North East will be in Tier 3. But across the whole country, obesity remains a serious factor in COVID-19. And yesterday, the All-Party Group on Obesity launched its report to build on the government's own obesity strategy. So will the Minister meet with officers of the group to discuss the report's recommendations and work with us to ensure a focus on the prevention and treatment of obesity in the fight against COVID-19?
Yes, she and I share an enthusiasm for this agenda, and we share our enthusiasm with the Prime Minister, who is a personal convert to the need to tackle obesity. And in fact, this crisis shows how important it is, because if you are obese, you are more likely to have a more serious impact of COVID if you catch it.
Rob Butler.
Thank you very much, Madam Deputy Speaker. We have consistently been told that we must accept restrictions to protect the NHS, and Bucks Healthcare Trust has done an amazing job in dealing with the pandemic from the very beginning. So can my right honourable friend therefore explain the weighting he puts on the pressures on the local NHS as one of the 5 indicators in the decision-making process over tiers? Because it would be very difficult indeed for people in Aylesbury to accept stringent controls on our lives and livelihoods if in fact there's plenty of capacity in hospitals for both COVID and non-COVID cases.
Well, we look at all 5 indicators essentially equally, but what I would say is that the pressure on the NHS, the point about pressure on the NHS, is a more sensitive indicator on the decision for going into tier 3, because if you're in the situation that Buckinghamshire is, for instance, where the case rate is elevated, but it's not as high as in many other parts of the country, the key thing to try to do is to keep that case rate where it is or lower. And we couldn't make the decision to put Buckinghamshire into tier 1, because if it goes up from where it is, then it won't be long until Buckinghamshire were in trouble. And therefore the decision to put it into tier 2, and I very much hope that cases can continue to go down until they're very low, like they are in Cornwall and on the Isle of Wight, for instance, and then we'll be able to review and consider tier 1. I hope that's a reasonable explanation, this is something that we need to continue to debate as we try to ensure that we get the judgments around these geographies exactly right.
Rachel Hopkins.
Thank you, Madam Deputy Speaker. The good people of Luton will want to get out of Tier 2 as soon as possible, but the current resources provided to Luton Council for the lateral flow rapid testing pilot are insufficient to enable it to provide the level of mass testing that is being described nationally. The contained funding, £8 per person, just won't cover tests for 10% of Luton's population, as the funding also needs to be used for the wider COVID response, including wellbeing support for residents, for vulnerable residents. Can the Secretary of State confirm that there are national plans to provide additional support and resources to expand testing if the intention to test close contacts daily is pursued?
Yes, there'll be further funding for those areas that go into Tier 2, and yet more funding for the areas that go into Tier 3, to go to the councils for the extra support that's needed.
Christian Wakeford.
Thank you, Madam Deputy Speaker. I want to thank my right honourable friend, the Prime Minister, for the flexibility they're providing so that we can all have a family Christmas. However, I asked my right honourable friend what consideration have been given to Hanukkah starting in 2 weeks today regarding family gatherings and public menorah lightings, and if no flexibility is shown to the Jewish community, does he think this is fair?
We carefully considered this issue and consulted on it too, and discussed widely. The Christmas is a national holiday, as well as being very much a Christian celebration. That's reflected in the fact, for instance, that we have 2 days of bank holidays, and we consulted members of different faiths around precisely the question that my honourable friend rightly raises. And actually there was a strong degree of support for having something special in place for Christmas for everybody, even though we haven't been able to put that in place, whether for Hanukkah or indeed for other celebrations from other faiths.
Liz Twist.
Thank you, Madam Deputy Speaker. And can I start by assuring the Secretary of State that Directors of Public Health and local authorities in the LA7 area and the wider North East are certainly very focused on getting down that figure and have had some success. So I'd like to make that absolutely clear. The second point I'd like to make is that my constituents and others across the North East will be hugely disappointed to find that they're in Tier 3, particularly those businesses in hospitality and leisure, which are going to be so desperately hit by this. But the real point I want to make is about public health. Nothing has shown more than this pandemic that public health should be at the heart of what we do. We know that it affects outcomes in COVID-19, and we know that it affects health inequalities, affect the rate of transmission as well. So can the Secretary of State make sure that he impresses on the Chancellor and asks the Chancellor for more funding for public health services now and in the future?
Yes, I agree with every word of what the Honourable Lady said.
Bob Stewart.
Thank you very much, Madam Deputy Speaker. My constituency of Beckenham is very relieved to be in Tier 2. Very kind of you, Secretary of State. Can I ask, because I've had a couple of constituents ask me, whether they have to have a vaccination. I've said, no, they don't, as far as I know, but could I ask my right honourable friend whether he can tell the House what percentage of the population required to be vaccinated in order for the measures to be effective so we can get back to normal?
Thank you very much. I would urge everybody to get a vaccination if we manage to get a vaccine that is approved by the authorities, because the regulator will only approve a vaccine if it is safe and effective. But having said that, we are not planning to make it mandatory, because we hope that the vast majority of people will take it up, not least because it will help to protect them and to protect their community and get this whole country, and indeed the world, out of the mess that we're in.
Now we go to Barbara Keeley.
Thank you, Madam Deputy Speaker. The Winter Plan confirms the government will be taking action to restrict the movement of care staff between care homes. On the face of it, that's a perfectly sensible infection control measure. But many care staff are forced to work between multiple homes because of low hourly wages. Can the Secretary of State therefore give a commitment that care workers will suffer no loss of income as a result of this policy? And can he set out what he will do to ensure that no care staff actually lose any of their jobs because they're being forced to choose between the different homes they work in?
Well, I hope that we can... I hope that partly through this measure, also through the increase in the national living wage that the Chancellor confirmed yesterday, we can improve the pay and conditions of staff across social care, because the proportion of people in social care who do work in a number of settings and work in agency and less secure work actually is, in my view, something that we should tackle together. And so I hope that we can use what is obviously put in place, as she quite rightly says, for public health infection control reasons, also to improve the standards of employment across social care, which is of course directly contracted by local authorities rather than by the central government, but nevertheless an area that I think we all know that we need to work to improve as a nation.
Dr. Julian Lewis.
Thank you, Madam Deputy Speaker. I'm sure my right honourable friend appreciates that many elderly people die with serious illnesses such as prostate cancer, but not from those illnesses. How certain is he that statistics showing the number of people dying with COVID-19 are not being presented or misinterpreted as people dying from COVID-19?
Well, the statistics on the number of people dying with COVID-19 is the best estimate that the statistics authorities, both in Public Health England and the Office for National Statistics, come up with. It is one of the widest definitions that countries use internationally, and therefore it does, as he implies in his question, include people who may have died of something else but with COVID. Nevertheless, Each of these deaths we should work to avoid. And the best measure, according to the Chief Medical Officer, is the total number of excess deaths compared to this time of year last year. And that is elevated now, and we need to get it down.
We go now to Leila Moran.
Thank you, Madam Deputy Speaker. May I first thank the Secretary of State for listening to local leaders who have been pushing for a one Oxfordshire approach to coronavirus as we go into Tier 2. I'm sure many residents understand the need to be careful for Christmas. Despite Oxfordshire's data being better than surrounding counties, we cannot risk any further damaging lockdowns. The reason we've done so well is superb team working in a county-wide systems approach involving all councils, the NHS and businesses. And in particular, we were quick off the mark to implement a locally test, trace and isolate system that is paying dividends. Does he agree that the key to beating this virus is to treat local areas as partners? And when they say they should be moving up and down tiers, that he will give their voice considerable weight?
Yes, I do give considerable weight to local leaders when they make a case for a particular tier for their area. And in her case, I'd like to pay tribute to Ian Hudspeth, who has worked incredibly hard during this crisis for the benefit of people right across Oxfordshire. I talk to him regularly about the situation in Oxfordshire, and Oxfordshire has made great strides in tackling this virus, including tackling the student outbreak at the university or universities in Oxford. I hope that they can work to get Oxfordshire appropriately down into Tier 1 as soon as possible, but there's some work still to do.
Anthony Higginbotham.
Thank you, Madam Deputy Speaker. Today's decision will be disappointing to businesses and residents across Burnley who have had extra restrictions on their lives and their businesses for longer than most. So could my right honourable friend set out exactly what support is going to go to Burnley and the wider Lancashire area, and when it will be delivered, so we can end these restrictions as soon as we possibly can?
Yes, Madam Deputy Speaker, Burnley has been in restrictions for a long time now and has brought its case rate down by about half since the peak in late September. My honourable friend has played a dutiful and impressive role in his public leadership within Burnley. I hope that we can work with Burnley Council, also with Lancashire County Council, to get the case rate down, to get Lancashire down into Tier 2, in the same way that Liverpool has managed to come down into Tier 2, a combination of people following the rules and that community testing. That is available to people in Lancashire. I very much hope to be able to work with the team in Burnley and across Lancashire to make this happen. And the final thing I'd say, Madam Deputy Speaker, is these are tough measures. I get that. I understand the impact on hospitality, but they are done for the right reasons, which is to keep people safe and to stop the local NHS being overwhelmed.
Charlotte Nichols.
Thank you, Madam Deputy Speaker. Warrington will be breathing a sigh of relief that we are emerging from national lockdown into Tier 2. But while I welcome the return of fans to stadia, I cannot support the extension of the substantial meal requirement to Tier 2, which will leave many pubs across my constituency closed. The pub sector faces an existential threat, and it flies in the face of logic and fairness that thousands can congregate at the rugby, but wet pubs that are the heart of our community must stay closed. Will he commit to publishing the specific evidence that underpinned the substantial meal requirement extension, and if he cannot, to removing this requirement?
Unfortunately, we will not be removing this requirement from Tier 2. It is incredibly important that we keep the cases under control. The local team in Warrington have worked very hard, along with the Liverpool City region, to get the case rate down. They went into national lockdown in Tier 3, they've come out in Tier 2, and the people of Warrington should be commended for that. But the measures of Tier 2 are necessary to keep the virus under control, because unfortunately the virus thrives on when people get together. She mentioned the point about events in larger scale. They will only be done where there is very stringent social distancing, so there will not be congregations, as she said, of thousands of people. I'd like to reassure her of that, because these events will only take place when the the capacity in normal times of any venue is much, much bigger than the number of people who are there.
Suzanne Webb.
Thank you, Madam Deputy Speaker. Firstly, I would like to thank the hard work and sacrifice made by residents in my constituency whose borough has been hard hit by the virus. With my constituency being in one of the worst affected areas, would my right honourable friend consider rolling out the vaccine as a priority when it is ready to the country's worst affected areas who have not only been blighted by this virus but hard hit economically? These are the areas that will be in much need of assistance to get back on their feet due to prolonged lockdown of the local economy, whilst also providing the much needed respite the vaccine will bring in these worst affected areas.
Madam Deputy Speaker, we've taken the decision to roll out the vaccine UK-wide at the same pace. I want to get it as soon as possible to the West Midlands and to everywhere else. But it is fair to the areas also that have had a low incidence of disease, or relatively low, to make sure they also have access to the vaccine. It also, the incidence in different parts of the country change, and this vaccine rollout programme is very complicated. It doesn't actually speed up the delivery of the vaccine in one area to have slowed it down in another area, and that's why we've taken the UK-wide approach.
Nosrat Ghani.
Madam Deputy Speaker, in keeping with my right honourable friend's spirit of working together, I stand not only to represent Wilden, but speak on behalf of my colleagues, the MP for Bexhill and Battle, the MP for Eastbourne and the MP for Hastings. We wish to collectively thank the CEOs of the CCG, ESH, our county leader Keith Glazier and our local Department for Public Health for working with us day in, day out to understand the data and the reasons for the infection rates. So we are deeply disappointed that, considering all the 5 indicators where we mark extremely low, that we are in Tier 2. And we are disappointed that central government has not consulted with these local leaders, because then they would have been able to investigate the data and hopefully show us how we can move into Tier 1 into Tier 2. Can I ask my right honourable friend to provide some assurances that these conversations will take place with local leaders, and also confirm that transparent, objective criteria will be published for each criteria, for each tier, and also how we can slide between each tier as well. Thank you.
Yes, absolutely. I can give both of those assurances. Across Sussex, case rates are at 120. They do need to come down. Like her, I'd like to see Sussex get to Tier 1 as soon as is possible. And we'll keep talking to the local area. As I said earlier, all directors of public health have been invited to discussions and consultations with the public health team, and that feedback fed into these decisions. But we've got to make sure those conversations continue. And the key message to everybody across Sussex and in the Wealden in particular is to, if we all stick together and if we all follow the rules, then we know that we can get this virus under control, and that will then lead directly to the lifting of restrictions, which we'll regularly review.
Now we go to Motherwell, to Marion Fellows.
Thank you, Madam Deputy Speaker. The Secretary of State will be aware of reports on the Oxford vaccine that the subgroup was suggested 90% effectiveness was due to a manufacturing error rather than being a planned protocol. Included fewer than 3,000 people and did not have any participants over 55. Does he agree, therefore, that further research is required to verify the efficacy of the lower dose in all age groups before it can be adopted as a standard regimen?
Questions over the interpretation of the data in the clinical trials are rightly for the MHRA, who will assess these clinical trials, and they will only approve a vaccine for use if it is effective and safe.
And now we go to Colne Valley, to Jason McCartney.
Thank you, Madam Deputy Speaker. So the first review of Kirklees being in Tier 3 will be on the 16th of December. Will the Secretary of State for Health please confirm that his department will consult with local MPs, council leaders and the local Director of Public Health? Will he publish the full numerical criteria so that we know what we need to achieve to get out of Tier 3? Will the government support Kirklees in delivering mass testing? And finally, will he have a conversation with the Chancellor about delivering extra financial support for our hospitality businesses?
I will absolutely take up all of those suggestions. We are in discussions with Kirklees about what further we can do, including in the area of large-scale community testing and the other considerations that are necessary to make that happen.
And finally, we go to Upper Ban, to Carla Lockett.
Thank you, Madam Deputy Speaker. The Secretary of State is to be commended for his initiative that he and the Care Minister had spearheaded to allow close contact visits between relatives and residents in the care home setting. Will this proposed access vary depending on what tier a home is located in? And whilst I acknowledge this is a devolved issue, with little progress being made in this regard in Northern Ireland, will he undertake to share the experiences of his pilot with the Health Minister in Northern Ireland so that my constituents can also look to have these visits with loved ones as soon as possible?
Madam Deputy Speaker, subject to the results of the pilots which are ongoing, we hope in England to allow testing to allow for visiting in care homes before Christmas. I will absolutely have another conversation with my opposite number, Robin Swan, who is the Health Minister for Northern Ireland. Robin Swan is an excellent Health Minister. We work very closely together. I'm absolutely sure that together we will be able to make progress on testing and on other matters. He and I are in constant touch about how we can best serve the communities of Northern Ireland from the position of the UK government in our role in procuring tests around the world and of course his vital role in keeping people safe right across the province.
I thank the Secretary of State. We have completed the statement. So in order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next item of business, I will suspend the House for 3 minutes. Order! Order. I now call Secretary Dominic Raab to make a statement.
Thank you, Madam Deputy Speaker. Can I make a statement to the House on official development assistance? The House will know that my right honourable friend, the Chancellor, updated the House yesterday on the economic challenges posed by COVID-19. It is a truly sobering assessment. The UK is facing the worst economic contraction in almost 300 years, a budget deficit of close to £400 billion, double that we faced during the last financial crisis. Britain is responding to a health emergency, but also an economic emergency, and every penny of public spending will rightly come under intense scrutiny by our constituents. Given the impact of this global pandemic on the economy and, as a result, the public finances, we have concluded after extensive consideration, and I have to say with regret, that we can't for the moment meet our target of spending 0.7% of GNI on ODA, and we will move to a target of 0.5% next year. Let me reassure the House, this is a temporary measure. It is a measure we have taken as a matter of necessity, and we will return to 0.7% when the fiscal situation permits. Madam Deputy Speaker, the relevant legislation, the International Official Development Assistance Target Act 2015, envisages circumstances in which the 0.7% target may not be met in particular in the context of economic pressures. The Act provides for accountability to Parliament in that event, and I will of course report to the House in the proper way. Equally, given the requirements of the Act and the fact that we can't at this moment predict with certainty when the current fiscal circumstances will have sufficiently improved and our need to plan accordingly, we will need to bring forward legislation in due course. Madam Deputy Speaker, of course, we are not alone in facing these painful choices. All countries are reconciling themselves not just to the health impact of the pandemic, but also the economic impact of COVID-19. It's worth saying that on the 2019 OECD data, only one other G20 member allocated 0.5% or more of GNI to development spending, and that was before the pandemic. So many countries are reappraising their spending plans, as we have been forced to do. As a result of this, nevertheless, we expect our development spending next year to total around £10 billion, maintaining our status as one of the leading countries in the world in terms of our ODA spend. So I can reassure the House that we will retain our position as a leader in the global fight against poverty. We will remain committed to following the rules set by the OECD's Development Assistance Committee, and we will ensure the maximum impact from our aid through the strategic integration we're driving as a result of the merger at the FCDO, the strategic thinking that's informed by the integrated review, and the further changes that we are now making on how we allocate ODA to support a more integrated and overarching approach. Let me say a little bit more, Madam Deputy Speaker, on that integrated approach. Our starting point is the integrated review, and with that review we are setting the long-term strategic aims of our international work based on our values and grounded in the British national interest. To achieve this, we will be taking a far more joined-up approach right across the breadth of government. That's why the Prime Minister created the FCDO, bringing diplomacy and development together in lockstep with the work of our other government departments. ODA is a vital, a central, and an absolutely indispensable element of that strategic approach. But to maximise its effectiveness, it must be used in combination with our development policy expertise, our security deployments and support abroad, and the strengthened global cooperation that we drive through our diplomatic network. We make our aid go further by bringing it together with all of these other elements and by making sure that they're all aligned and pushing in the same direction. Last week, the Prime Minister set out how we are strengthening our defence and security capabilities. That will boost our standing in the world whilst also contributing to our development efforts, including our soft power abroad. The clearest illustration of that, Madam Deputy Speaker, I think is the peacekeeping that we do. We have British troop deployments in Afghanistan, in South Sudan, in Somalia, in the Democratic Republic of Congo and elsewhere, which work hand in hand with our development and our diplomatic efforts. And indeed, we're demonstrating that with our latest deployment of 300 UK troops to Mali. Our security and defence budget also helps countries to deal with the new emerging and evolving threats. For example, supporting Nigeria and Kenya to assess and strengthen their cybersecurity resilience. Now, we will set out the full detail of the integrated review early in the new year as we launch our presidencies of the G7 and COP26, with 2021 a year of leadership for global Britain as a force for good in the world. Madam Deputy Speaker, this new strategic approach will allow us to drive greater impact from our £10 billion of ODA budget and spending next year, notwithstanding the very difficult financial pressures that we face. And I will prioritise that £10 billion of spending in 5 particular ways. First, we will prioritise measures to tackle climate change, protect biodiversity, finance low carbon and climate resilient technologies such as solar and wind in poor and emerging economies. I can reassure the House that we will maintain our commitment to double international climate finance, vital to maintaining our ambitions in this area as we host COP26. We will leverage our aid support through our diplomatic network to galvanise global action and to make sure that countries come forward with ambitious, game-changing commitments in the lead up to November next year. Second, we'll prioritise measures to tackle COVID and promote wider international health security. We will maintain our position as a world leader investing in the Gavi Vaccine Alliance, COVAX, the Global Fund for AIDS, TB and Malaria, and the International Finance Facility for Immunisation. We will continue to support and strengthen the World Health Organization as the second largest state donor, and I spoke to Dr. Tedros just yesterday about our efforts in that regard. And we will use all of our other levers to maximise British impact. For example, we've magnified our COVAX contribution through our diplomatic efforts, which helped to convince the board of the World Bank to announce an additional funding last month of up to $12 billion for COVID vaccines, tests and treatments. And I spoke to World Bank President David Malpass just last night about our important collaboration in that area. Third, we continue to prioritise girls' education. Because, Madam Deputy Speaker, it is the right thing to do, and because the fortunes of so many of the poorest countries depend on tapping the full potential of all of their people, which must include women and girls in education. Our global target, working with our partners, is to get 40 million girls into education and have 20 million more girls reading by the age of 10. It's a major priority for Global Britain as a leading supporter of the Global Partnership for Education. And just next year, we will raise $4 billion globally, including through our UK-Kenya summit. Fourth, Madam Deputy Speaker, we will focus ODA on resolving conflicts, alleviating humanitarian crises, defending open societies, and promoting trade and investment, including by increasing UK partnerships in science, research and technology, because these are the building blocks of development and they require long-term strategic commitment. Finally, Madam Deputy Speaker, at all times we will look to improve our delivery of aid in order to increase the impact that our policy interventions have on the ground in the countries and the communities that they are designed to benefit and help. We will strengthen accountability and value for money, reducing reliance on expensive consultants for project management, strengthening our in-house capability to give us more direct oversight and control, including by removing the total operating cost limits that were originally introduced when DFID was first established, a limit which only applied to DFID. And as a result of this spending review, the FCDO will now take on a greater role in ensuring the coherence and coordination of development-related spending right across Whitehall. So to maximise the strategic focus that I've talked about, I will run a short cross-government process to review, appraise and finalise all of the UK's ODA allocations for next year in the lead up to Christmas. Madam Deputy Speaker, this is a moment of unprecedented challenge, and on all sides of the House we are defined by our willingness to make the difficult choices, not just the easy ones. And with the approach that I've set out, we will maintain our international ambition. We will deliver greater impact from our aid budget at a time of unparalleled financial pressure. Mr. Speaker, Madam Deputy Speaker, forgive me. Like many in this House, I'm proud of our aid spend. I'm proud of the big-hearted generosity of the British public, which we amplify with our diplomatic energy on the world stage. I'm proud of the huge amount we do to support the poorest and the most vulnerable right around the world. The United Kingdom is out there every single day. Our people on the ground, in the disaster zones, in the refugee camps, tackling famine and drought, helping lift people out of poverty, striving to resolve conflicts, and striving to build a more hopeful future for the millions of people struggling and striving against the odds. Even in the toughest economic times, we will continue that mission, we will continue to lead, and I commend this statement to the House.
Preet Cordial.
Thank you, Madam Deputy Speaker. Last week, the Prime Minister promised to end an era of retreat. Yet today signals the biggest retreat by a British government from our global role in decades. They have removed any credibility the UK has as a force for good in the world and made it harder for us to pursue our national interest and create a safer, healthier, fairer and better world for us all. Make no mistake, Madam Deputy Speaker, our traditional allies and our detractors will take note of this move. This government has destroyed the long-standing cross-party support for spending 0.7% of GNI to eradicate global poverty and reneged on their promise to the British people, breaking a manifesto commitment and turning their backs on all those they promised to champion. Mothers, newborn babies and children who are dying from preventable causes, the tens of millions of girls who are out of school and those whose lives and livelihoods have been destroyed by Ebola and malaria. Britain and the world deserve better than a Foreign Secretary who has allowed the aid budget to be slashed, leaving our global reputation lying in tatters ahead of a year when the UK hosts the G7 and COP26. Madam Deputy Speaker, we know that we need a dramatic acceleration in the pace and scale of global climate action, and we all want the UN Climate Conference to be a success. But for that to happen, we must harness the political will of other countries. As hosts, it falls to the UK to lead by example, not withdraw, yet cutting the aid budget does exactly that, and has already attracted outspoken criticism from vital partners. I pity the Foreign Secretary having to explain to his counterparts that this is all part of his and the Prime Minister's idea of global Britain. His government has repeatedly delayed their review of foreign policy, with announcements being made on a whim. Madam Deputy Speaker, it is a disintegrated review. Does the government actually have a strategy, a plan, or even a vague idea? I've lost track of the number of times the Secretary of State has announced new development priorities, so perhaps he can confirm how long he will stick with these. Under the Conservatives, foreign aid has been diverted away from the world's poorest. Will he now ensure that it is not squandered on vanity projects, but instead is focused on eradicating poverty and inequality? In the year since the Conservatives pledged to proudly uphold the law to spend 0.7% of GNI on aid in their manifesto, we've been told by the Prime Minister that spending 0.7% of GNI was a goal that remains our commitment. The Secretary of State has said the commitment is written in law and will be the beating heart of our foreign policy. His ministers, the members for Braintree and Rochford and Southend East, have told us the government are completely committed to the 0.7% target because it is the right thing to do. And we are bound by law to spend 0.7%, so it's not a choice, they say. It is in the law and we will obey the law. Now they've decided they don't actually like obeying the law. Madam Deputy Speaker, this government is developing a reputation, and many within his own party don't like what they see. Yesterday, his own minister resigned because abandoning our commitment risks undermining efforts to promote a global Britain. I stand ready to work with her and with the members for Mid Derbyshire, West Worcestershire, Preseli, Pembrokeshire, Sutton Coldfield, Ashford, South West Surrey, Wyre Forest, the chairs of the Defence and Foreign Affairs Select Committees and the Father on the House, and many more who I do not have time to list, to stop this retreat from happening. Madam Deputy Speaker, can the Secretary of State tell us when the necessary legislation will be brought forward, and can he confirm that he will spend 0.7% of GNI on aid this year and what the estimated value of ODA will be? This government loves to blame others for its shortcomings, especially when they can't answer back. And rather than taking responsibility for their incompetence, spending £12 billion on a COVID test and trace scheme that still isn't working, or wasting taxpayers' money on over 184 million items of unusable PPE, this government has chosen to make the world's poorest pay for its failures. The British people are extremely compassionate. They've seen a global health crisis cause devastation around the world, push millions of people into poverty, costing lives and livelihoods. And they know that this isn't a necessity, but a political choice that this government have made. We stand with them and oppose this ill-conceived, short-sighted decision. Thank you.
Secretary of State.
Thank you, Madam Deputy Speaker. Well, where to start with that, Madam Deputy Speaker? She referred to a range of different issues. She referred to the UK's work on disease and girls' education. We entirely agree. These are total priorities, and that's why I appreciate her. I appreciate her response was written before she listened to what I said, but that's why I set out the priorities, so I could give her and the House the reassurance that actually those are two areas that we will safeguard and prioritise. No, we said we will safeguard the priorities. She asked about climate change, as I made clear. Our first priority will be to prioritise measures to tackle climate change, protect biodiversity, and we will maintain our commitment to double the international climate finance, which I agree with her is very important as we go into COP26. She asked about our international partners. Of course, our international partners, whether they're NGOs or the heads of the international organisations, want as much generosity as they possibly can. We understand that. But I spoke to the Secretary General of the United Nations, the President of the World Bank, Dr. Tedros at the WTO yesterday. At the WHO yesterday. They understand the financial challenges, they understand the health challenges, and they know that we will be a stalwart leading member of the international community as a force for good in the world, notwithstanding the pressures that we and many others will now face. She asked about the legislation. We will bring forward that in due course. Obviously, we want to make sure that that's as well prepared and carefully thought through as possible. She says we don't have to. Actually, on the one hand, she said that we're breaking the law and changing our mind on the law. It's very clear under the legislation. She should go and check. No, again, from the sedentary position, he says if it's temporary, that's not what the legislation says. He should go and look very carefully. Well, he hasn't got this quite right, and we've taken advice very carefully on this. It's very clear that we cannot, if we cannot see a path forward back to point 7 in the foreseeable immediate future, and we can't plan for that, then the legislation would require us to change it. And we'd almost certainly face legal challenge if we don't very carefully follow it. The Honourable Lady asked about 0.7. That will still apply this year, and I can give her that reassurance. She criticises the government for the choices that we've had to make in the face of a global pandemic, in the face of a financial emergency. It's not clear to me what the choices that Labour Party would make or that she would make. Was she suggesting earlier that we cut the money from...
Order! Talking over the Secretary of State. Secretary of State.
Thank you, Madam Deputy Speaker. Was she suggesting that we divert money from test and trace at this pivotal moment in the pandemic in order to meet the 0.7%? Is she suggesting any area from the extra investment in schools, hospitals, policing yesterday that should be cut in order to meet the 0.7%? She's shaking her head. In fairness to the Honourable Lady, she has previously said that ODA should be cut because of the impact of the economy. She said it in the context of the GNI review, and I can quote her because she's shaking her head. She said in the context of the GNI review that we've already conducted, and I quote verbatim, so we're accurate, "We recognise that there has got to be cuts made. We've had a drop in GNI. Those cuts should not come from DFID, but should come from other government departments and their spending on ODA." She's saying yes, yes, yes. So could she tell me, does she advocate cutting the amount of ODA that BEIS and DEFRA spend on climate change? We come back to the basic point that in the financial pressures that we face, difficult decisions need to be made.
Order, order. it is fine for the Secretary of State to ask a rhetorical question. It is not in order to have a dialogue from a sedentary position. A rhetorical question does not require an immediate answer. Secretary of State.
Thank you, Madam Deputy Speaker. The truth is that the Labour Party are, frankly, in this spending review, defined by their total inertia in face of the difficult decisions that we've had to make. And I'm afraid that gives them very little credibility when it comes to the SR. When it comes to 0.7%, frankly, Madam Deputy Speaker, the House should recall that the Labour Party has history on this. And honourable members across the House, particularly the more long-standing ones, will remember, because it was a Labour government under Harold Wilson back in 1974, the year I was born, Madam Deputy Speaker, that first set the target for 0.7. The year I was born, as I said. In the 46 years since, the whole of my lifetime, no Labour government has ever hit 0.7, not in a single year. And the Honourable Lady has talked about the hyperbolic, with hyperbolic language, about the damage that we will do with a £10 billion ODA budget with a shift to 0.5%. Can I just remind her, in the 13 years of the last Labour government, not only did they never once hit 0.7, not only did they never hit 0.7 in any year. Well, he doesn't like it, the Honourable Gentleman. I'll come to the Honourable Gentleman in a second. I'll come to the Honourable Gentleman in a second. They only ever hit 0.5% in 2 years out of 30. Madam Deputy Speaker, don't take my word for it. The Shadow Africa Minister, the Honourable Member for Cardiff South, was a SPAD in DFID under the last Labour government. She says it went up. A government which on average spent 0.36% of GNI on ODA. With a record like that, the Honourable Gentleman, rather than chuntering from a sedentary position, should stay quiet on this subject. Because on this side of the House, with our record, we will take no lectures from the Labour Party when it comes to ODA.
Tom Tugendhat.
Thank you, Madam Deputy Speaker. It feels almost rude to interrupt a private dialogue. May I say that I understand the pain that this economy and economic collapse is causing all of us. I have just received the appalling news that the whole of Kent has gone into Tier 3, and I'm aware of the pain that this is going to be causing communities across my own constituency. But may I also say that the reason I supported his taking over the DFID portfolio was because I knew the rigour that he would bring to ODA spending would mean that it was always in the British national interest. And indeed, the way he's spoken about it this morning reassures me of that. He's spoken quite rightly about girls' education, not just because it's good for girls in other parts of the world, but because it's good for Britain. He's spoken about climate change, not just because it's good for the poorest and most low-lying countries around the world, but because it's good for Britain. He's spoken about vaccination, not just because it's most important for the most vulnerable in the world, but again because it's good for Britain. So does he understand why so many of us are disappointed? That knowing how well he's going to spend this money, not just in the interests of others, but in the British national interest, that we're hearing that it's cut. Now, I'm sure he feels that too. So could I perhaps ask him to look at a slightly different way of counting? Because we all know that the 1970s rules on DAC need to be reformed. I'm not alone in saying this. The French government said it, the Netherlands government said it, the German government said it. In fact, I think I'm right in saying everybody except the Swedish government has said it. Could we not count the enormous sums that he is already spending on vaccination programs through the Vaccine Task Force, the enormous money he's spending on UN duties, not just the 15% that the DAC allows him to count? Could we not count that stability as our ODA capability and reinforce what he has done? And then perhaps we can look at the bill that he may be forced to introduce and make sure it isn't an open-ended bill, but it has a sunset clause in black and white that we vote on too.
Thank you, Madam Deputy Speaker. Can I thank my honourable friend, the Chair of the Select Committee? He's absolutely right, and I said it at the outset. We make this decision with regret. I don't want to be in a position having to change any of the ODA spend. I know how valuable it can be. and notwithstanding our absolute commitment to strategically focus it on the places that the people that need it the most, of the areas of maximum UK interest, of course this is something that we do with regret. We do it as a matter of the necessity of the economic situation we face, and it will be temporary, and we will revert to 0.7 as soon as the fiscal position allows. He's asked a range of questions about whether we could reconfigure money. We're not going to unilaterally pull out of the DAC rules, but he makes a good case for reform of the DAC rules. For example, some of the military spend, particularly on peacekeeping and other things, isn't counted, but it is clearly not just good in terms of military security in the countries with which it's focused, but actually an important element of soft power. And is something we should do. But I have to say to him, I think the right thing to do is to work on that reform from within DAC rather than pulling out unilaterally, and that will take some time to do. So I take on board his comments. He asked about how we will make sure we get back to it. I'm very happy to keep talking to him about that. The number one thing, though, in my view, and I would gently suggest to him, is we are still spending £10 billion next year on ODA. And when I think of what he said about his constituents and how they will feel about the latest measures, and we're all challenged by this, I think they will think that we are making difficult decisions, but the right ones and the justifiable ones in the very exacting situation that we find ourselves.
Thank you, Madam Deputy Speaker. To govern is to choose. And as one government to another, of course the SNP has been in government since 2007, we understand it's difficult. We're in unprecedented times. There are tough choices. A lot of people are afraid and feeling very vulnerable. But there is always going to be domestic pressure on the aid budget. And the UK government has, with this, made a choice, an active choice of deep consequence. And the fact is, this is not what was promised. This is not what was promised to the people of Scotland in 2014. This is not what was promised in the Conservative Manifesto 11 months ago. Now, the Foreign Secretary talks about scrutiny of spend. I absolutely agree. But my inbox, I dare say colleagues feel the same, is unanimous this morning against this move. It's fair to say in Scotland we have a disproportionate interest in international development because of our history we have with our churches, our NGOs, our trade unions, our universities. Civic Scotland is keen on international development. DFID is based in East Kilbride, now merged, of course, into the FCDO. And this is a betrayal. Not just a betrayal of those promises, but a betrayal of some of the poorest and most vulnerable people in the world who are also facing COVID, the economic consequences, climate change, and are going to be left by this in a dreadful situation. Now, when I say betrayal, actually I would exempt the Foreign Secretary from that. I don't think this is coming from him. I don't think he stopped it, but I don't think it's actually coming from him. I think it's coming from the people around him, behind him, the people in the shadows, with their phony think tanks and their blogs, the people who proudly denigrate international aid because it's against their project, the people who want to link international aid to trade policy in the most grubby way possible, the people who get excited about a red, white and blue tail fin on a flag, people who think that what we need right now to buoy our spirits is a new royal yacht, people who want to spend, as the government has committed to, £120 million on a festival of Brexit. Ye gods! We've got today, Madam Deputy Speaker, a moment of real clarity and divergence. Real clarity and divergence that Scotland and the UK are two different places with two different ambitions and two different paths. It is a matter of fact that the cynics were right. After the UK's politicisation of aid by merging DFID into the FCDO, there has been a crippling raid on its budget. DFID in East Kilbride is a deeply sad place this morning. And Scotland Independent, because of our interest, because of our history, because of our capacity and ambition, we will put international development at its heart. We will be committed to the 0.7%. And it's clearer than ever today to the people of Scotland that the best way to achieve that aid policy, to be that global citizen, is independence.
Hear, hear.
Thank you, Madam Deputy Speaker. Well, can I first of all say, in relation to East Kilbride, notwithstanding the pressures we face, we will be expanding the UK Government, the Foreign Commonwealth Development Office in East Kilbride, because we know the great work that they do, and because we are stronger on the international stage when we're united. He said that it wasn't what was promised, this decision wasn't what was promised in 2014 or at the last election. I hesitate to just remind him that was before the pandemic. That was before coronavirus. That was before we were faced with, well, and he referred to the fact, and he's quite right to say, there are always domestic pressures, that always competing priorities in relation to the public finances. But I have to say to him, we're not under any normal set of circumstances. We've got the worst economic contraction in over 300 years. We've got a deficit double the size that we faced after the last financial crash. And we're having to make very difficult decisions. If he thinks we've made the wrong one, I would like to hear from the SNP, rhetorical, not an actual question, what he thinks that we should have cut. What was the money, the investment the Chancellor announced yesterday that he thinks actually should be cut in order to hit 0.7%? He referred to I thought it was actually pretty unsavoury language, referring to it as a crippling raid on ODA. We are spending next year £10 billion. And I think that our constituents, and it may be his inbox is different from mine, I think our constituents will understand, because they live in the real world, that we have to make difficult decisions. And that is still an extraordinary contribution that the taxpayers of this country will be making to alleviate suffering and poverty around the world.
Bottomley.
Can I suggest that we squint at the nettles in what was said yesterday and what's said today? Clearly, it would be illuminating to be able to see the messages that the Foreign Secretary will have sent to the Treasury and the Prime Minister arguing against this cut. We know that it's not his idea. Can I ask him how much the amount of money would have gone down if we kept to the 0.7? With 11% contraction of the economy, is that well over £1 billion? How much extra is being taken by coming down to the 0.7? Is the proposed legislation designed to make sure we come back to the 0.7 or make it possible to avoid coming back to it for a long time? I end by saying I first stood for election when the Foreign Secretary was born. I became a trustee of Christian Aid to fight to get the government to meet the commitment it had made a long time before to meet 0.7. I rejoiced when we met it. It wasn't a Liberal Democrat put on us, it was in our manifesto in 2010. And I'm glad that the Foreign Secretary was able to say in July that we were going to stick to 0.7.
Can I thank my honourable friend? And look, he will be able to work out that the difference is £4 billion in savings next year as a result of this. Of course, we looked at could we just follow the contraction of GNI in order to deliver the savings that we need. Of course, we looked at that. We looked at every single option. But the challenge we've got is the pandemic is uncertain. That's what we found. In the throes of coming out of a second national lockdown. As a result of that, the impact on the economy is not just profound, but also uncertain, and the impact on the public finances. He asked, I think, some further questions about the seriousness about getting back to 0.7. We are serious. He's right to say it was a manifesto commitment that we're proud of. I do think the country, though, expects us to stand up and make difficult decisions, given the necessity of the situation that we face. We've made it clear it is temporary. We'll get back to it just as soon as the public finances allow.
Now we're going to Rotherham, to Sarah Champion.
Thank you, Madam Deputy Speaker. In the last 6 months, the Foreign Secretary has closed DFID, tried to abolish the International Development Select Committee and cut over a third of the aid budget. We still have no clarity where those cuts have or will be made, or the consequences of them. I've got specific concerns about some of the areas he details as priorities, as I think they may fall outside of the ODA definition. The science element is written to fit the heavily criticised Newton Fund, and the trade aspect could lead to tied aid. In his letter to me, he states, too often aid has lacked coherence, oversight, or appropriate accountability across Whitehall. The same could be said in relation to Parliament. So to address this, will he agree that he will present an impact assessment of the cuts to the House? And will he also agree to support IDC's change of remit so that we can scrutinise across all of ODA, so that both the taxpayers and members of Parliament can be assured that this money is being well spent?
Thank you, Madam Deputy Speaker. I have to say to the Honourable Lady, who I respect and admire greatly. We haven't closed DFID, we have merged the Foreign Office and DFID precisely to give greater impact given the financial pressures we face now. She asked about tide aid. We're not suggesting any reversion to tide aid. I think that comes from a bygone era, and that is not something that I support or this government supports. Nor have we tried to abolish the Select Committee. I've made it clear every time I've been asked. These are matters for the House to decide. Finally, she asked about when we will publish the GNI review detail breakdown. We're obviously committed to full transparency, and the statistics on international development are published next year, and they will be provided via a detailed breakdown of all the ODA allocations in 2020.
Now we go to Berwick-upon-Tweed, to Anne-Marie Trevelyan.
Thank you, Madam Deputy Speaker. I thank the Foreign Secretary for his statement today. The Chancellor's statement yesterday setting out plans to amend the International Development Act and reduce ODA spending for the next few years is profoundly upsetting to many, as it suggests that the UK is stepping back from its world-class, globally respected and unstinting commitment to supporting developing countries. I know that this anxiety is unfounded. So does the Foreign Secretary agree with me that whilst the silo budgets classified as ODA are going to be squeezed, we should take the opportunity which the global financial crisis has forced on everyone, as the Chairman of the Foreign Affairs Select Committee just set out, to fully review the DAC rules on which we classify our ODA spending, and in the meantime to make clear to the House all government spending which works to strengthen the stability, governance, health, education. And may I take the opportunity, Madam Deputy Speaker, to thank Baroness Sugg for her extraordinary work over the last year on girls' education, and indeed on climate shock resilience for developing countries, which supports all the SDGs. And can he commit to review the historic multilateral payments commitments, which I believe could be much more impactfully used to drive the UK's priorities?
Thank you, Madam Deputy Speaker. Can I thank my right honourable friend? Can I join with her in paying tribute to Baroness Sugg, a terrific minister, and she will be greatly missed. Can I also congratulate her on her appointment as the UK's international champion on various different climate change issues with her expertise and, I know, passion and dedication in that area. She makes an excellent case for taking a more strategic approach, not just in relation to the ODA spend that derives from the SEDO, but looking right across the piece, across Whitehall, to make sure that it's allocated in the areas it has the greatest life-changing impact. We will do that on climate change, on biodiversity, and we will do it on girls' education and helping the very poorest around the world.
Hilary Benn.
Thank you very much indeed, Madam Deputy Speaker. For the record, the ODA GNI figure in 2010, the last year of the previous Labour government, was 0.57%. Can I say to the Foreign Secretary that of all the promises our country has made, to choose this particular promise to break to the world's poorest people is unforgivable. We're talking here about a cut of 1/3, roughly, in the aid budget. And the thought that some babies may not be delivered safely, or some children may not be able to go to school, or some children may not be vaccinated, so that they don't die of the diseases that our children don't die of, should trouble every single one of us. Yeah. Now, the Foreign Secretary said that he is intending to make decisions about where these reductions will fall before Christmas. But can I ask him to give the House an assurance that the decision about whether this is going to go ahead will be brought to Parliament so that we can decide whether to break our promise or instead to keep our word?
Yeah. Thank you, Madam Deputy Speaker. Can I thank the honourable gentleman? I know he cares about this subject very passionately. He himself served as Development Secretary. He used, frankly, rather hyperbolic language, I have to say, but he should have noted, at least, the reassurance I gave about the strategic prioritisation, even with a reduced financial envelope, to our commitment to disease, and in particular immunisation and vaccinisation. around TB, around obviously COVID, malaria and the like. He will have also noted, because he mentioned school, I mentioned that we will be safeguarding girls' education. He wanted to trade figures with me, so I might just, and I hope he will bear with me, just note that when he became Development Secretary in 2003, ODA spend in that year was 0.34% of GNI. When he left in 2007, it was 0.36%. We're the ones on this side of the House that hit 0.7%. We're proud of that. We will go to 0.5% next year. And he, I think I'm right in saying, only in 1 year of the tenure that he was Development Secretary did the last Labour government hit 0.5%. I think he should have just a little bit more humility when he engages in quite such hyperbolic critique of what we've achieved on this side of the House.
Andrew Mitchell.
Thank you, Madam Deputy Speaker, and may I thank the Foreign Secretary very much for his courtesy over recent months and for his support for the Independent Commission on Aid Impact, which is extremely welcome, and for his kind comments about Lady Sugg, who was a brilliant development minister. And I hope everyone in the House will read her principled and moving resignation letter, which she released yesterday. My right honourable friend and I both know that seen from the Biden White House, this is a dismal start to our G7 chairmanship. And as the former Prime Minister said yesterday, the point 7 is a promise that we as Tories do not need to break. And he knows, does he not, that taking a further 30% out of the development budget will drive a horse and cart through many of the plans that the British government has so strongly supported for eliminating poverty. It will withdraw access to family planning and contraception for more than 7 million women, with all the misery that that will entail. 100,000 children will die from preventable diseases. 2 million, mainly children, will suffer much more steeply as a result of these changes from malnutrition and starvation. And in spite of what he says, which is extremely welcome, about prioritising girls' education, on the existing plans, probably 1 million girls will not be able to go to school. Madam Deputy Speaker, I hope you will bear in mind that these figures, these reductions, make little difference to us in the United Kingdom, but they make a massive difference to them.
Thank you, Madam Deputy Speaker. Can I pay tribute to my right honourable friend? He was a fantastic Development Secretary. We've talked at length since our time in opposition about these issues, and I will continue to do so. He mentioned a number of points. First of all, just on he read out some statistics. With respect, I don't think it's possible to say with the precision that he did about the implications, because we're not going to take a salami slicing approach of just saying, well, we're going to cut a third from all areas of ODA. That is not what we're going to do. We're going to take a strategic approach. We'll safeguard those areas that we regard as an absolute priority, including many of the things that he mentioned, particularly on public health and international public health, alongside COVID, alongside climate change and girls' education. He talked about IKI. As he knows, I'm committed to reinforcing the role of IKI. We welcome the transparency and the scrutiny. And finally, he talked about the US. I have to say respectfully, I disagree. At 0.5% next year, we'll still be spending a greater proportion of GNI than the US, and I think actually they will welcome, given the widespread cross-party concerns they have around defence spending within the European context, they welcome the fact that we're increasing our security and defence budget.
Peter Kyle.
Thank you, Madam Deputy Speaker. If during a global pandemic, government doesn't accept that solving problems abroad before they reach our shores is one that's worth doing, then it's an argument we are never going to win. There has been a year-on-year reduction in deaths from terrorism and extremism from parts of the country where we have been investing huge amounts of development resources. Now that we are withdrawing that resource, the opposite will happen. This is also an economic argument, because where we have to use the military to respond to extremism, civil strife, and the breakdown of law and order, we put British armed forces, our service people, in danger. We spend an absolute fortune and Britain ends up paying a very high price for our credibility. Does he not accept that where we withdraw international development, aid and resource, we will end up paying far, far more by using the military in the long term? This is an economic and a military argument.
Before the Foreign Secretary answers this question, I must point out to the House that when a minister makes a statement, the idea is that people ask questions, short questions. You're not meant to be making speeches. A question is one phrase with a question mark at the end. It doesn't require lots of statistics. It doesn't require a huge preamble. And it doesn't require lots of rhetoric. We're only a quarter of the way through the people who have asked to speak in this statement, and yet we've used up 3/4 of the hour allocated to it. And that simply isn't fair for the other people who have yet to ask their questions. So I beg for short questions. And then if the questions are short, it will be easier for the Foreign Secretary to give shorter answers too. Secretary of State.
Madam Deputy Speaker, I'll take that encouragement. The Honourable Gentleman asked about two things in particular. I accept the premise that our security is strengthened by the action we take abroad. Of course, that does include the reverse proposition, which is our defence and security spend abroad, including some of the stuff that is covered and stuff that isn't covered by ODA, also has a soft power impact. And I mentioned cyber, the creation of the new National Cyber Force and Artificial Intelligence Agency is important to protect us here, but also reinforce the capabilities of our most vulnerable partners abroad. He also mentioned health. I've explained at some length why we'll be safeguarding and prioritising our international public health spending.
Now we go to Basildon, to Stephen Metcalfe.
Thank you, Madam Deputy Speaker, and can I thank my right honourable friend for his statement. And whilst I'm a supporter of our 0.7% commitment, I do understand in these difficult times, tough decisions have to be made. Will he therefore again confirm that it is the government's intention to return to 0.7 when the situation allows? And will he join me in again reminding the House that while the party opposite are expressing outrage, that they never hit 0.7% themselves, and our 0.5% will stand very well in comparison?
Can I say to my honourable friend, he's absolutely right. They barely hit 0.5, let alone 0.7. But I do accept that there is cross-party concern about this very challenging set of circumstances and the difficult decisions. The difference is that we are making those difficult decisions and we're being honest and upfront with the British public about it.
We go to Oxford, to Leila Moran.
Thank you, Madam Deputy Speaker. This proposed cut in aid spending, breaking our nation's promise to the world's poorest, is not just callous and unnecessary, but also entirely against our own self-interest. We are currently an aid superpower, and this move undermines the soft power we so desperately need in the post-Brexit era. I and the Liberal Democrats will join all others across this House to fight this short-sighted move. The Foreign Secretary says he's doing this with regret, and I believe him. But does the Foreign Secretary accept that in a few years he may well regret what he is doing?
Well, I have to say to the Honourable Lady, I share her passion and commitment to the role ODA plays and our soft power abroad. I just gently remind her at 0.5%, we will still be on the 2019 figures, the second biggest ODA spender. I just say to her, like we say to all the other parties and all honourable members, can she explain how else she will deal with the financial emergency we now face? Because I haven't heard a peep of other positive, credible alternatives from the Lib Dems, let alone the benches opposite.
Jerome Mayhew.
Madam Deputy Speaker, one of the most shocking parts of the Chancellor's statement yesterday was that this year we will be borrowing £396 billion this year alone, with a further £369 billion to come by 2023. Given this truly parlous state of our public finances, does my right honourable friend agree that this temporary cut to our foreign aid budget, deeply regrettable as it is a necessary reflection of our altered circumstances and needed, frankly, to keep our aid spending in line with our taxpayers' priorities?
Well, can I thank my honourable friend? And I think as the Chancellor said at the dispatch box yesterday, I think, notwithstanding the regret, notwithstanding the financial pressures, it would be very difficult to justify to our constituents, with all that they're going through, with all that they expect of what we do domestically, if we weren't looking at every area, including this area, to try and see our way through. But as he rightly said, it is temporary, and we will get back to 0.7 when the financial conditions allow.
And now we go by audio link only, as we're having difficulty with the proper link, to Margaret Ferrier.
Thank you very much, Madam Deputy Speaker. International aid saves lives, it supports the world's most fragile, and it gives the world hope. Not my words, but the words of just one of many constituents who have contacted me to express their anger and sadness at the decision to reduce the international aid budget to 0.5% of GDP. Has the Foreign Secretary carried out an impact assessment identifying how many lives could potentially be lost as a result of slashing assistance to some of the world's poorest countries?
Well, can I thank the Honourable Lady and just say we are still going to be spending £10 billion next year, and we are going to, and I will run an allocation process which allows all the other departments that bid for aspects of ODA to scrutinise very carefully to mitigate against precisely the risks that she talked about.
Dr. Kieran Mullen.
I do deeply respect arguments against this decision, but will the Foreign Secretary agree with me that to describe the enormous amounts of money that we will continue to spend, taxpayers' money, as dismal and unforgivable and some of the characterisations we've heard today actually damages public support for this cause in the long run?
I have to say, I think my honourable friend has got a point. I think he's got a point about the way our constituents will view the decisions that we take. We need to make sure that everything we do on our aid budget, our development, and indeed our wider foreign policy abroad attracts and commands the confidence of them. And I think if we immunised somehow the ODA budget in a way that no other budget domestically has been immunised, I think they would ask questions, if not be very concerned with that approach. So I think he's right.
Now we go to Carla Lockhart.
Thank you, Madam Deputy Speaker. In light of the announced reduction in the aid budget, will the Foreign Secretary commit to ensuring that aid will be focused on areas of utmost need, such as tackling the systemic issues and cultures of impunity, which enable modern slavery and violence to affect the world's poorest people?
The Honourable Lady is absolutely right, and I set out the list of priorities, including conflict prevention, accountability, promoting accountability in countries, and dealing with violence, particularly violence against women, but frankly all violence against civilians in those conflict situations. We're going to run the allocation process to make sure that our top priorities, of which those she mentioned are included, are safeguarded as best we can in the reduced financial envelope that we face.
Now we go up to Lincoln, to Carl McCartney.
Thank you, Deputy Speaker. I understand the difficult financial decisions that we as a government have had to make at this unprecedented time. However, I know that all on our side of the House will agree that we need to ensure our foreign aid is targeted to the most vulnerable in the world. When the Independent Commission for Aid Impact Report is published later this year, will my right honourable friend come back to the House and update honourable and right honourable members with exactly how we can target our support better to ensure it reaches the world's most vulnerable?
My honourable friend is right, and he will recall I said back in August that we wanted to reinforce, not undermine, the role of the Independent Commission for Aid Impact, to strengthen the transparency, to reinforce the accountability, and to make sure that it is we're getting the very best critical analysis about where we have the most impact. As soon as the review is finalised, copies will be placed in the libraries of the House and shared with select committees, and I will make a statement to the House.
Now we go to Swansea, to Geraint Davis.
Madam Deputy Speaker, the Foreign Secretary says that this cut is both temporary and a matter of necessity. But whilst borrowing is up, the overall costs of borrowing has fallen due to falling interest rates, yet the poorest countries are not able to respond to the economic consequences of COVID in the way that richer countries can in this way. So as we are the global host of the G7, the UN Security Council, and COP26, will he press the Chancellor in this and all years to basically lead by example for global Britain, in particular in relation to the new US Biden administration, to leverage more funds from the US as well, so the poorer nations get the best deal in the worst year, next year of all years, when it's needed most?
Secretary of State.
Can I thank the Honourable Gentleman? I think he makes an excellent point, I have to say, which is that we're facing acute difficulties and we're very concerned, of course, on health grounds, but also financial grounds, what that will mean for the most vulnerable countries. We have a direct stake in that, as well as a moral responsibility. And in everything from what we're doing on IMF debt relief, World Bank projects, and indeed the allocation review that I've already mentioned to the House, we will safeguard the £10 billion to make sure it's focused on shoring up the poorer countries, the most vulnerable countries, as they come through this pandemic.
And now we go to Crawley, to Henry Smith.
Thank you, Madam Deputy Speaker. As a member of the International Development Select Committee during the previous Parliament, I quite understand the need for the UK to live within its means in these exceptional circumstances. And I welcome the fact that we are still spending more of our gross national income than the vast majority of other countries around the world on development. But can I have an assurance from the Secretary of State that no more UK aid will go to China, a country that is in effect developed and one that has, of course, a very poor human rights record?
Secretary of State.
Can I thank my honourable friend? He may know that we ended bilateral aid to China in 2011. There is still a case, though, I would say, for some collaboration in the development space with China. And the example I tend to give is climate change, where yes, China is the biggest net emitter, but it is also the biggest investor in renewables. And that actually, with all the other challenges that we have with China, is an area where we do want to try and work positively and engage positively.
And now we go to Aberdeenshire, to Richard Thompson.
Madam Deputy Speaker, over the past few weeks, the UK government has threatened to break international law and is now retreating from pledges given both domestically and internationally to support some of the world's most vulnerable people in a time of unprecedented global crisis. I wonder, Madam Deputy Speaker, can the Foreign Secretary really be content at the way his government's policy is undermining the UK's international standing and claims to global leadership and seeing them shrivel so miserably under his watch?
Secretary of State.
I have to say, the wonderful thing about this job is when you travel abroad, you realise the high esteem with which we are held, not just for our democracy and our way of life here in the United Kingdom, but the contribution that we make. I hear that on both sides of the aisle in the United States, and there's lots of talk about the renewed approach to multilateralism from President-elect Biden. I heard that in the calls I've made from Dr. Tedros, from David Malpass at the World Bank, and indeed from Antonio Guterres. I think if he encourages me to look at the United Kingdom in the way that others do, I would just point him to the Ipsos Mori service done by the British Council, which showed amongst particularly young people around the world, we are rated as the most attractive country with the highest trust alongside Canada for our institutions here.
We now go to Theo Clark.
Thank you, Madam Deputy Speaker. As a long-term supporter of our Global Britain agenda, of which aid is a very key part, I am deeply concerned by the announcement yesterday that we will not be keeping to 0.7 next year. Whilst I appreciate the difficult economic decisions this government has had to make due to the coronavirus pandemic, given it is also a manifesto commitment, can my right honourable friend confirm to me that this is only a fall to 0.5, which is temporary? And I note the government has said we will return to 0.7 when the fiscal situation allows. What exactly does that mean? And can he set out now the steps the government will take to return us to this aid target?
Foreign Secretary.
Thank you, Madam Deputy Speaker. Can I first of all pay tribute to my honourable friend for the enormous expertise and experience that she brings to this House from the development sphere. I can confirm that it will be temporary. It is done as a matter of necessity with regret, as I've said already. She asked what are the steps that we will take. I think the most important thing is we'll need to see the impact of the virus on the economy and then on the public finances. We've come through what is effectively a second wave. We need to shore up against that. The measures that the government has announced are aimed to do that. We are hopeful about a vaccine for next year, but we have to be cautious about that because we're not there yet. And I'm afraid there is an inherent degree of uncertainty about the situation, which is why we're in the position of not just being able to rely on the limited derogation written into the legislation, which allows an ex post facto, if you like, derogation, having inadvertently missed the target. That's not the position we're in. So we will do it as soon as I said the fiscal conditions allow.
Nasham.
Thank you, Madam Deputy Speaker. From actively breaking international law in a very specific and limited way to breaking commitments of international aid, does the Foreign Secretary not realise how his government is slowly weaning away Britain's role as a world leader and day by day making us more irrelevant on the world stage? Every living Prime Minister can see why this move is morally wrong and politically unwise. Why can't the current Prime Minister and his government see that?
Foreign Secretary.
Can I thank the Honourable Lady? I think the current Prime Minister and certainly this Foreign Secretary gets a little bit fed up with hearing Britain being done down. And I have to say to her, when amidst a coronavirus pandemic, the fiscal conditions that we face, we're nonetheless putting £10 billion in, which on 2019 figures has us the second largest ODA contributor. And when I speak to our interlocutors abroad, from Asia to Africa, when I speak to our multilateral partners from Dr. Tedros to Antonio Guterres, they do not share this self-flagellating defeatism or this will to do Britain down. They understand that we make an unparalleled contribution in the world as a force for good. We shall continue to do so.
22 withdrawn, so West Streeting.
Yeah. Thank you, Madam Deputy Speaker. We now know that because of the government's choices, the economic price facing the country is higher, that the manifesto commitments the Conservatives made last December cannot any longer be trusted. And when the government talks about hard choices, what they really mean are real terms pay cuts for key public sector workers like teachers and teaching assistants and police and firefighters, and cuts to support for the world's poorest. So can the Foreign Secretary at least tell us what he thinks the public will be more concerned about? Aid that goes to the world's poorest, which actually saves us money in the longer term, or the gross waste of public money through billions of pounds of poor government contracts and barrelfuls of public money handed over to Tory donors?
Foreign Secretary.
Thank you, Madam Deputy Speaker. I think that's the Twitter lined up for later on in the afternoon. I have to say to the honourable gentleman, he asked what the public expect. I think they ask us in a sober way to look at all the choices. We've done it. Well, the honourable lady has advocated cutting ODA in the past. She now shakes her head and she wants to fudge it as repurposing. We're not going to fudge it in the way that she does. We're going to be very honest with the British public. Incredibly difficult set of decisions. We're making sure that we can see our way through this pandemic, and we'll still be contributing £10 billion to the world's poorest, to climate change, to girls' education. I think they'll understand. And if he's got any alternatives, rather than just criticising from his side of the House, we'd be glad to hear them.
Order. I know how important this statement is, but we do have two further debates on climate change and on COVID-19, so I would urge colleagues to have fairly short questions and correspondingly short answers. We now go to Marco Longhi.
Thank you, Madam Deputy Speaker. A short question coming up. Would my right honourable friend please confirm to the House that the UK's aid spend will, in fact, be also focused on ensuring that the most vulnerable around the world get access to vaccines?
Foreign Secretary.
Thank you, Madam Deputy Speaker. He's absolutely right. We've demonstrated that through our leadership at the Gavi Summit. We've demonstrated that through our leadership role funding and galvanising international funding for COVAX. We will continue to do so.
We now go to Dave Dugan.
Thank you, Madam Deputy Speaker. The fact that the aid budget is set as a percentage of GNI means that it is necessarily self-regulating. Budget allocations on this basis remain consistent with the prevailing economic conditions. So if 0.7% was okay for normal times, surely it must be fine for lean times too. So having reneged on a key Tory manifesto commitment less than a year after the election, in itself surely something of a record, can the Secretary of State advise what detailed analysis he has commissioned to quantify the cost to humanity of removing £4 billion in aid from the poorest communities in the teeth of a global pandemic?
Foreign Secretary.
Can I thank the honourable gentleman? I don't think it's right to say that just because there's a percentage based on GNI that it means that we could deal with a situation of the severity that we face now, the worst economic contraction in more than 300 years, a budget deficit double that of the last financial crisis. This isn't ordinary times where the natural stabiliser built into that target can apply. He asked how we will safeguard how we'll prioritise. We have an allocations process. We're not going to be salami slicing ODA across the different pots of money. We're going to make sure we do it in a strategic way, and I'll be taking that forward in the weeks leading up to Christmas.
Nusrat Ghani.
Thank you, Madam Deputy Speaker. My right honourable friend has said that going forward, the right decisions were made to deal with everything from poverty to extremism. For that to be the case, my right honourable friend has to focus on the safety and security of women and girls, and that requires access to good and safe education. Can my right honourable friend update us on how he will continue to do that? And during this week against violence against women, the greatest number of women that are being abused are Uyghur women by the Chinese state. Can my right honourable friend update us on what support he can provide Uyghur women?
Foreign Secretary.
Thank my honourable friend. I've set out before the House how we will safeguard what we're doing on girls' education and how we'll maintain our leadership role with the global targets that we set. We're very concerned about the position in Xinjiang. We have recently made Five Eyes statements on it, and in the Third Committee of the United Nations we brought together a much broader pool of countries to express our concern. I think what needs to happen now is that the UN's Human Rights Commissioner or another independent fact-finding body needs to be able to have access to check the facts, because China's rejoinder is always that this is just not happening. There are too many reports that it is, and I think we need to get to the bottom of this, and I think the UN Human Rights Commissioner has a role to play.
We now go to Debbie Abrahams.
Thank you, Madam Deputy Speaker. Providing overseas development aid is not a selfless act. It's in our interest to foster global peace and sustainable development, reducing the migration associated with war, climate change, disease and famine. So what is the Foreign Secretary's assessment of the impact on international peace building and migration associated with the government's choice to cut foreign aid?
Foreign Secretary.
Can I thank the honourable lady? I think she's absolutely right. I don't see a siloed distinction between our moral interest in what we do abroad and the national interest. Too often it's combined. What I would say on some of the areas that she's mentioned is look at what we're also doing on defence and security. It may not be strictly within the DAC rules, but it does have a huge impact on our soft power abroad and also the stability of the countries that she mentioned. And we're going to use the allocation process to make sure that we mitigate some of the concerns and the risks she's got. But of course, we won't be able to continue all of the funding that we're doing. These are the difficult choices that come as a matter of necessity in the emergency financial situation that I'm afraid that we find ourselves in.
We now go to Pauline Latham.
Thank you, Madam Deputy Speaker. The International Development Committee has long recommended that there should be a single sign-off by FCDO since the takeover of DFID on all UK ODA spend, no matter which department spends it. Who in the Foreign and Commonwealth and Development Office will ultimately be responsible for that, as I appreciate that the Foreign Secretary is far too busy?
Foreign Secretary.
Well, can I thank my honourable friend? Ultimately, the Secretary of State ministers are responsible to Parliament for the financial spending. What I would say is that we look very carefully at this, both the underspend and the overspend. We're constantly looking not just to strengthen our internal processes, and as a result of the merger we've looked again at that, but also through ICAI and the select committees in this House, we make sure we've got maximum transparency, and if she's got any other specific proposals in that regard, I'd be very happy to consider them.
Stephen Flynn.
Thank you, Madam Deputy Speaker. On the 30th of June, the Secretary of State said in response to a question from my friend, the member from Angus, and I quote, "I assure the honourable gentleman that we are committed to spending 0.7% of GNI on aid." So can the Secretary of State confirm, was he not being truthful with the House at that time, or did the Chancellor and the Prime Minister simply not tell him what they were planning to do?
Foreign Secretary.
Well, I understand actually, missed all the hyperbole, the point he's making, but the truth is the full scale of the economic situation wasn't clear. It wasn't clear because we'd actually coming through. Well, the Honourable Gentleman is chuntering. Let me answer the question. I'm trying to take him seriously on this, and he should listen to the answer. The fact is, if he looks in June, we were coming through the first wave. We hadn't got ourselves to a position of having to go into a second lockdown, and frankly, the full financial effects were not clear. So he's right to make that point, but I think there's a very clear reason why we've had to take the measures that we've taken, which we take as a matter of regret. We wanted to avoid that, but it is because of the nature of this virus and the prolonged financial impact it's had on businesses, and as a result of that, on the public finances.
Harriet Baldwin.
Thank you, Madam Deputy Speaker. And our economy has taken a terrible shock this year, and that's why point 7 means that we've already had to cut aid by 2.9 billion this year. Yesterday, I heard an update from the World Food Programme in South Sudan, and they have had an even worse economic shock, not just COVID, but also the ongoing conflict, the fact that they've had locusts, they've had absolutely biblical floods, and now more than half of the population is facing famine. The Foreign Secretary recently sent his special envoy for famine prevention and humanitarian affairs to South Sudan. Can he reassure the House that he will make no further cuts in the programming in South Sudan?
Foreign Secretary.
Can I thank my honourable friend? She's absolutely right to point to South Sudan. I could, to the list of countries that risk the compound effect of conflict, COVID plus famine, you could add Yemen, Burkina Faso, northeast Nigeria, which is why we and I launched first UK Special Envoy for Famine Prevention and Humanitarian Affairs in the form of Nick Dyer, and is also why, as we go through the allocation process that I described to the House, these are precisely the things, conflict, humanitarian and COVID, that we will look very carefully to safeguard for all the reasons that she described.
Devendra Mishra.
Madam Deputy Speaker, the UK is seen as a world leader when it comes to international development. Our legislation ensures that aid is focused on poverty reduction. Can the Foreign Secretary share his views on tied aid and address the concerns of numerous members on both sides of this House on this government making a return to tied aid, which will harm not only the people who benefit from UK aid, but also our nation's reputation globally?
Foreign Secretary.
I thank the honourable gentleman. He asked a really good question. I don't agree with tied aid. I don't believe we should go back to that system. I think it's from a bygone era. But I have listened very carefully to leading economists like Paul Collier and in particular Stephen Durkin, who's talked about the fact that the most enduring and profitable, i.e. for the countries affected, long-term partnerships, ones that are sustainable, do have a sense of partnership and two-way benefit. That's what makes them enduring in partnership. I was so impressed with the argument by Stephen Durkin that I hired him into the new FCDO when we merged the department to make sure we had a really good progressive approach to the partnerships, particularly the long-term partnerships that we take with those countries.
We now go to Craig Whitaker. We will come back to Craig Whitaker because he's muted. I will go to Stephen Timms and then try to come back to Craig Whitaker. Stephen Timms.
Thank you, Madam Deputy Speaker. The churches played the key role in the 20-year cross-party consensus on aid, and I pay tribute to their achievement since Jubilee 2000 and Make Poverty History. Yeah. We all realised what abolishing DFID really meant. Why didn't he realise it?
Foreign Secretary.
Well, first of all, I join him in paying tribute to the churches. Maybe they have a power of foresight that has been lost on humble politicians, but all I would say is I don't think, even in the point at which we did the merger, anyone could have foreseen the depth of the financial implications. As a former Treasury Minister, I think he would understand this. He's been through the process. The analysis was not there, and the structural hit, not just 1 year, but the structural hit to the public finances wasn't clear at that time. It is clear now. We've had to take a difficult decision, and I have to say to him, as a former minister in the last government, these are decisions that typically it's Conservative governments that front up, and on the Labour side they abdicate.
We now go to Crispin Blunt.
Can I welcome the opportunities that an integrated budget provides, and can I also welcome the Foreign Secretary's focus on defending open societies? And after the Prime Minister's affirmative reply to my letters to the Foreign Secretary of the 4th of September and the 12th of October about securing global Britain's leadership on LGBT+ rights, will he undertake to instruct officials to engage with the United Kingdom Alliance for Global Equality and any other relevant organisations to help formulate the programmes of work that could be delivered and announced by the Prime Minister or himself when the United Kingdom hosts the Global Equality Coalition Conference next year?
Foreign Secretary.
Thank you, Madam Deputy Speaker. Can I pay tribute to the honourable gentleman, my honourable friend, who's championed this cause relentlessly and with great passion and great eloquence. We are a global leader in this. We should be proud of it. I am proud of it. We are proud to be the Equal Rights Coalition co-chair with Argentina, and we are ambitious about what we can achieve through that strategy and the impact it will have. He talked about NGOs. Civil society has an incredibly important role to play, and we are committed to working with all the NGOs, including the UK Alliance for Global Equality, in the weeks and months ahead.
We'll now return back to Craig Whitaker.
Thank you, Madam Deputy Speaker. Having experienced 3 100-year floods within 8 years, we're only too aware in the Calder Valley of how vital immediate emergency help is from government. And whilst I agree with the short-term reduction in international aid because of the massive generational cost of borrowing money, amongst other things, would my right honourable friend agree with me that the UK should continue to be a major donor in addressing the worst humanitarian and natural disaster crises throughout the world?
Foreign Secretary.
Can I thank my honourable friend? As I set out, that is of course one of the priorities that we will safeguard as we reduce the financial envelope. He's absolutely right. I think there's cross-party consensus. I think in the public, for all the criticism there sometimes is of the overspend, alleviating conflict and dealing with the aftermath of humanitarian disasters is what ODA should be spent on, what it should be prioritised on, and that's what this government in Global Britain is all about.
Bambos Charalambos.
Thank you, Madam Deputy Speaker. The pandemic has reminded us that the virus does not respect borders. Countries with weaker health systems, poor water and sanitation facilities are less likely to defeat COVID-19, maintaining the virus's threat to the UK and the world. So can the Secretary of State confirm if this was taken into account when making the decision to cut the vital aid, and can he explain what he means by returning to the 0.7 commitment when the fiscal situation allows? What metrics will be used to determine that point in time?
Foreign Secretary.
Can I thank the honourable gentleman? He's absolutely right about COVID and other public health priorities. That's why, as I set out and wanted to set out, we're not just taking a salami slicing approach to the 10 billion of ODA next year. We'll look strategically. That, of course, as I've already said, is one of the priorities. It's difficult to give him the precision he may want on when fiscal conditions will allow us to get back to 0.7, but that's a result of the pandemic, and I'm sure we'll have greater clarity as the weeks and months go ahead. We've got to get through this pandemic, allow the economy to recover, but this is a temporary measure taken as a matter of necessity, and we will get back to 0.7 as soon as the fiscal conditions allow.
Last question, Anthony Mangnall.
Deputy Speaker, to say that I am disappointed in this decision is an understatement. I am horrified that we have decided to break a manifesto commitment, and I am horrified the message that this sends to the many women who have suffered such horrendous acts of sexual violence in conflict, especially given the fact that yesterday was the UN Day for an international elimination for the violence against women. I just asked why the Foreign Secretary, and I know how hard it is because he didn't want this decision, why the Foreign Secretary and the government didn't look at reforming it and looking at a multi-year funding formula rather than a calendar year to reach the 0.7%, which would have given us the long-term strategy and the commitment to the world's poorest.
Murphy.
Can I, thank you, Madam Deputy Speaker, can I thank him for what he's saying? Look, I understand he's trying to be constructive, and if he, as I think he's referring to the idea that we could reform and change the approach, which as many have suggested even before the pandemic, to say that the 0.7% commitment is averaged out over several years. I understand that. I think it's a good proposal. It's something that perhaps we should consider in any event. But the reality is that the depth of the economic hit, the depth of the contraction and the knock-on effect of the public finances means I'm afraid that wouldn't be able to satisfy the challenge and the extent of the necessity that we face in terms of trying to reconcile domestic and international priorities.
Thank you. We'll now have a 3-minute suspension for allowing the safe exit and entry of honourable and right honourable members.